There you are.
Now I can hear you.
That's good. I'm so glad.
Sorry for...
No worries. Do you want to change your name?
I did it.
Did we ever find the AI companion for this? There he is. There's the man. How are you, Dr. Alki? Welcome. Long time no see.
Already?
Were you here last time? Last time, Dr. Hayakawa was with us last time. I don't think you were with us.
Yeah, I went to the annual Congress of Pediatrics.
Do you want to tell us about that?
Not so.
It's not so interesting.
My residents presented a poster presentation.
Okay.
And I was the supervisor, so I just joined because I'm a pediatrician. Sometimes I need to join pediatric events.
Can I ask both of you to please bring your cameras down a little bit so we can see? There you go. That looks more natural. Thank you.
So how is the weather in Osaka?
It's not good. It's raining.
Yeah, I think so.
Yeah, it's a rainy day, but April showers bring May flowers.
Mm-hmm.
And what do May flowers bring?
Mayflower.
Mayflowers bring the pilgrims.
I don't know.
Oh, you don't know that? I can show you. Pilgrims of the Mayflower. There we go. There's the Mayflower, and there are the pilgrims. They're going to America. They got kicked out of Europe. So the Mayflower was the ship that carried the first American settlers from England. Yeah, okay. It's a joke.
What is pilgrims?
What are pilgrims? The first European settlers in America.
Oh.
Yeah. Those were the pilgrims. I don't know if you've ever seen like Thanksgiving. The pilgrims were the white people in America. The Indians, we called them Indians, were the indigenous people of America. And the first white settlers from Europe were called pilgrims.
Okay. I know the indigenous people.
Indigenous.
But the opposite.
The opposite, the white people. The pilgrims, we called them pilgrims.
From Europe.
Yeah, from England, actually. The Mayflower was from England.
I see.
Yeah.
So Mayflower was the name of the ship.
Yep, the Mayflower was the name of the ship.
Of the robber.
Yep. That's the Mayflower.
Mm-hmm.
Took them like 6 weeks or something to get across the Atlantic Ocean.
Yeah.
Can you imagine? Can you imagine being 6 weeks on a ship and then you get to America and there's no food? They starved to death. And the Indians, the indigenous people, helped them. They taught them how to harvest corn, right? Corn, what's corn? They didn't know what corn was. There were no pigs. There were no cows. There were no horses in America. Life was hard. Europe is full of sausages and milk and cheese, right? But they get to America and there's no pigs, no horses, no cows, no wheat. The indigenous people were eating corn. Corn? What's that? They didn't know. They were starving. And the indigenous people helped them survive. And then we celebrate what's called Thanksgiving. So that Thanksgiving is an American holiday. Europeans don't. Europeans celebrate other holidays, like even Halloween, I think, but they don't celebrate Thanksgiving. Yeah. Anyway,
so the Thanksgiving is kind of appreciation from indigenous people.
No, it's not, and that's kind of sad. Thanksgiving is when we thank God for the gifts.
No,
But the reality is we need to thank the indigenous people for our survival. So maybe the story has evolved and people have a better understanding today. You know, there's a lot of mythology about the past that's not reality. So education, we need to educate people on the true history. Ryotaro, since Dr. Aoki's busy on the phone, you might want to begin your presentation.
Okay.
Yeah.
So today, I prepare the indirect hernia, inguinal hernia.
Indirect hernia.
Indirect hernia. Yeah.
Is there such a thing as a direct hernia?
Mm-hmm.
Okay,
So
let's
both
discuss.
I will introduce.
Let's discuss.
Just a moment, please.
Sure.
Sorry. Oh,
Dr. Aoki, were we able to turn on the AI companion for this?
maybe I already turned on.
Okay, thank you. So will there be a transcript of this meeting? Oh,
Maybe
my.
later.
That's so sad. That's just a baby.
Yeah.
Oh my.
Inguinal hernia.
Yes.
Sample of a male, indirect inguinal hernia, 6-year-old female, chief complaint. It is a complaint. Yeah,
Tiny T.
complain is a verb and complaint is a noun.
Thank you.
Who are they? Who are they?
Who are they?
Yep, it says they
The
perform.
doctors.
So we would say,
Mhm.
we need to put this in passive voice. Are you familiar with passive voice?
A little, I think.
Let me.
Maybe you can say just we.
No.
We.
No. We
Why?
no. Sorry. No. A manual reduction was performed. Yes.
But in this case, we want to know who did that operation.
No.
I think this is the kind of American English and the British English, right? British English prefer to use active voice rather than passive voice, if I'm not mistaken.
So in a case report, the case is the chief subject, right? So a manual reduction was performed.
Okay.
Yeah.
Oh, Ryotaro is now pediatric surgery, or
No,
so.
just surgery. And one of the department was pediatrics
Okay.
surgery. So I just see the surgery was performed.
How many manual reductions?
Just one.
Okay, so please indicate
And
that.
reduction.
How
Can we
many
count the
manual
reduction?
Ryotaro, listen carefully. How many manual reductions?
how many manual deduction? Just one. So you mean I need to make
Yes.
A here?
Yay! Thank you.
Oh, thank you.
But it, and what is it? I'm sorry, we need to be specific. The bulge.
So the hernia. Oh.
Yeah, let's call it the hernia. That's good. The hernia. Okay, great.
Can I ask just history more detail?
Okay.
How long the symptoms last before the presentation?
The symptom was occur from two weeks ago, and 6-year-old is very older
Interesting.
than usual patient, I think.
Now, my question is: this sample image. Was there more information on that sample image?
Just saying the hernia here.
Can we say sample image of infant male? Because this looks like an infant. I'm not sure how old this male was.
So I don't know how old is he.
But definitely not 6-year-old.
Yeah, let's say sample image of
because this is a male.
Yeah, let's add the stipulation infant male. Sample image of infant male.
Infant.
Yeah. Thank you. That's better. Okay. Thank you.
I couldn't take the photo.
Yeah, I understand. Surgical treatment has been planned.
What's being?
Has been. There we go. Thank you.
Okay. Then
other questions before the next slide?
I don't think this hernia lasted for 2 weeks continuously. So I just guess, I think like a couple of hours before the presentation, she had a pain on the inguinal area, and they came to the hospital or something like that.
Oh, are you familiar with this case, Dr. Aoki?
No, this is not my case, but
so you would say that chief complaint would be the pain, and then the hernia presented after the pain.
I don't. How do you think? Did the patient had pain or no?
There was no pain.
Interesting.
No pain.
They said, and there was no pain, and
okay.
It's not very acute hernia. This was.
Okay.
I see. But in the content of the hernia would be intestine, right?
Yeah.
Interesting.
Let's move on to the next slide.
Okay.
Thank you.
Okay.
Indirect and direct inguinal hernias. Let's put an S at the end because we have 2 types. Thank you.
So the indirect inguinal hernia.
Inguinal. Yeah, it's like language.
Inguinal.
Yes.
Hernia passes through the inguinal canal. Here. Canal. Via the deep inguinal ring.
Oh my goodness.
And in contrast to the one, direct inguinal hernia.
Yes.
Protrudes directly through a weak point in the abdominal wall.
Oh, I see.
Here, the muscle.
Yes.
And pushes directly through the abdominal wall. So you say directing.
Now, my question is that direct hernias are more common in elderly patients or patients that have suffered some type of stress, like heavy lifting or that kind of thing. And then indirects are more common with younger patients. Is that the case?
So in infant,
Yes.
indirect is more common.
I see.
But I don't know that in case of elderly people.
Well, here's the thing about direct hernias is that they're usually the case in elderly patients and patients who have, performed heavy lifting and that kind of thing, right? They've overstressed their abdominal cavity, and they don't have the mechanical resistance because, tissue aging, and maybe they don't have the musculature that they had when they were younger, that kind of thing. So elderly people doing physical work, I think they're the most subject to this type of
physical
condition.
work. And the muscle will be weak.
Well, things happen. People get out of exercise, or even people in good condition as we age, things tend to, we have a saying, gravity wins, right? Yeah.
That's right.
Gravity wins. Also, because we are creatures that walk upright, we don't walk on four legs. So there's a lot of stress at the base of the abdominal cavity. It's kind of like a water balloon. When you fill the water balloon, how it starts to stretch as you fill it with water. Does that make sense to you, Ryotaro? Have you ever played with water balloons?
Yes.
Yeah, the more water you put in, the more stretching happens. That kind of thing. Yeah. Okay. Questions here?
Okay, I think the direct inguinal hernia is more common in elderly.
I would say so, yes.
Elderly men.
Yeah. I do have men, not women.
I think both. Yeah, women has a different type of hernias they have. Not
because anatomy.
Inguinal. I'm talking about inguinal hernia.
Yeah. Now, inguinals would be this type of herniation. Yeah. My father suffered abdominal hernia.
After the operation?
No, because he was lifting heavy objects on a construction site.
Yeah.
It wasn't
it's
inguinal,
possible.
It was abdominal.
Abdominal wall.
Yeah.
Other kinds of.
Now, is this indicative of some type of genetic condition because of this inguinal ring? Is there some kind of malformation of the anatomy or not?
I don't think there is general.
Okay. So what is the risk factor? What is the cause? It seems very strange that why would the intestines be following this inguinal pathway? Yeah. Okay.
I don't know.
Yeah. Let's leave that for further discussion. Okay. And this inguinal ring is also a part of female anatomy. It's not just a male anatomy.
Yeah, both have.
Okay. All right. Interesting.
Okay. So
thank you.
I move to the next slide.
Thank you.
So this we treated by laparoscopy. Laparoscope
on the 6-year-old female. Are these the actual case? No, this is from a file. This is a file photograph.
Internet.
That's fine.
They're similar.
That's fine. Thank you.
So you can see the hole here, right?
Yeah.
This is the hernia.
Okay.
And if the intestine goes through to the hole, it's sometimes hurt. Probably hurt. And
well, if it causes intestinal blockage, it could be fatal. Right? You do not want to have an intestinal blockage. Intestinal blockages are fatal. Do you understand, Ryotaro?
You mean that intestine?
This is a critical factor. So if you think about the human body as a donut, right? Imagine the human body as a donut. right? From the mouth to the anus without a hole. A donut is not a donut without a hole. Does that make sense? Take away the hole, it's not a donut. If there is not a clear pathway from the mouth to the anus, the human cannot survive. So this is kind of what we call a weak link in survival. A weak link. One failure and the organism dies. A chain is only as strong as its weakest link, right? If you pull on a chain, one of the links of the chain is weak, the whole chain fails. If you have an intestinal blockage, the organism cannot survive. So it would be lethal if this becomes an intestinal blockage.
Yes, this is the reason for the emergency surgery.
Yes.
Related to this condition.
Yeah.
But I think this one, the patient had already chronic problem without pain. So I'm just curious in content. Is it really intestine only or any other tissue? And really intestine have blockage or obstruction. I just want to know the exact pathology.
There may have been associated symptoms like vomiting or abdominal discomfort or lack of bowel movement.
This is the kinds of the bowel obstruction.
This is very critical surgery.
What's a surgical record, Ryotaro?
Surgical record?
Surgical record. Yeah, surgical record. Like, how did you reduce? How did they reduce the hernia?
So like this, we tie rigid. We tie the hernia's hole. Is this the answer of your question? I want to know what tissue, content is inside the hernia. The intestine was.
The small intestine.
The small bowel.
Yeah.
But not the not
Yeah. Okay, I understand.
All right.
So no ischemic change. So I think only mild blockage and blood perfusion was not restricted. Right.
But it could have advanced to much worse.
Yeah, could have. It's possible. Yeah. But in this case, luckily, the bowel obstruction was mildly. What can I say?
Well, it was the condition was addressed early. It was addressed promptly. Yeah. Okay. 2 weeks though. That's a little bit. Now here's another question. I'm sorry, uneducated question. This inguinal ring, it looks like it's been sutured closed. What is the purpose of the inguinal ring?
Oh, maybe Ryotaro can answer.
Yeah.
Anatomically, this is a very important tissue. Yeah.
So
what's a canal? What can be used this canal in the human body anatomically?
So anatomically, not very important for female.
But for the males, it is very important.
Yes, because there is. Can you see the picture here?
Yep.
There's a testis here.
Yes.
And I forgot the name.
Well, let's call it the associated plumbing. Okay. All the pipes and vessels that support the testes and allow the testes to produce its products are traveling in and out through this ring. But for the female, it's vestigial, if I get that right.
Mm-hmm.
Is that vestigial? Is that the term?
I don't know.
Vestigial. Vestigial, sorry. It's unnecessary.
Cord.
It's unnecessary. It's an unnecessary.
Like appendix.
Well, the appendix is not vestigial because it does have a function, but it's not totally necessary. For females, it's not necessary. For males, it's necessary. Basically, a male, when a male is developing in utero, do you understand what that means, Ryotaro? In utero?
Utero, I know, skew, right?
Yep. The ovaries descend and become the testes.
I know it.
Yeah, and that inguinal...
I need to explain that one, yeah.
Yeah, and the inguinal ring is where that occurs.
Yes.
So it's not necessary for a female.
Also,
males have nipples.
What is nipple?
Chikubi. Right? Males have nipples, so basically all humans start out as females, and the male is a advanced developmental stage from the female form.
Really?
Yeah. Yep.
So that's why I think this inguinal hernia for females, the ovary can be the content.
Oh, I see. Well, that's sad. Yeah, that would be very.
Ovary can be,
okay. Interesting. Good education here.
Yeah, thank you.
Okay. Is that the end?
Yes.
Okay, so do we have a prognosis on this case?
Prognosis.
Oh, surgical treatment has been planned, but so that surgery did not occur yet. Those were file images from the internet.
No. They occurred.
Oh.
And this yesterday.
So surgical treatment was performed.
Yeah, but at this time.
Yeah. Okay. That's fine. All right. Good. And did you receive a prognosis?
So, what is prognosis?
Prognosis is the expected outcome for the patient.
Outcome. After the treatment.
It's the expected outcome. We won't really know. It's almost a prediction. That's why it's called a prognosis.
Operation was going
successful.
Was perfect. Yeah.
Successful.
Successful. Yeah,
Yes.
successful.
Okay.
So she will be okay.
So the operation was successful and the prognosis is good.
Prognosis is good.
Yeah. Okay. Thank you. Good. That's good news.
Thank you.
Yeah. Good work, Ryotaro. Thank you. I learned something. Maybe I don't know if what? Go ahead. I'm sorry. I'm listening.
One point that very interesting was that the other side of the inguinal ring.
Yes.
Was same situation.
Wait a minute. So there are two inguinal rings. There's a left and a right inguinal ring.
Left was the intestine go through the ring, and by right side there was no intestine go, but there was a hole.
I see.
And
did they address the right side ring also with the suture?
Right side, yeah.
Okay.
Because she was a female.
Well, this is preventative surgery. Yeah.
But if she were a boy, the doctor says that if she were a boy, they don't perform the right side.
Interesting.
Because there are the cord.
Yeah, it's we will call it the
spermatic cord.
Testicular plumbing. I think they're called vesicles, but I'm not sure about that.
Yeah, so they don't want to damage the
For a male.
spermatic course. So
yeah.
If she were a boy, they don't perform to the right side.
Interesting. Wow. Dr. Aoki, anything else here?
Nice, good. Thank you.
Thank you, Ryotaro. I learned something.
Thank you. So, okay.
Thank you for sharing that. Good work.
Thank you.
You were in pediatrics, Dr. Aoki. Were you ever involved in this kind of surgery in pediatrics?
I had several cases. I referred to the pediatric surgery department. And when I was working in the PICU, I did manage some post-operation management in the ICU. But I think this case usually very simple. But when I was working in the PICU, I had a training in the anesthesia department in the pediatric hospital. So I witnessed many operations in the CRR. So this is a very common procedure, actually.
Wow, that's interesting.
Mm-hmm.
It is about 50 minutes.
Yeah.
Is the patient under general anesthesia?
Yes.
Okay.
I think I remember, if I'm not mistaken, as an anesthetist, of course, we performed general anesthesia, but we added local or local anesthesia or block, nervous block anesthesia.
Okay.
Did you see that, Ryotaro?
No, there was no nerval block anesthesia.
Neural, not nerval. Neural. Okay, interesting. So there was general and neural block.
But after the operation surgery, they performed the neural block.
Okay. Interesting. To avoid post-operative pain, I imagine. Yeah. Wow. Looking at these photographs, I see that during the surgery, first of all, there's light, which is interesting because this is laparoscopic. Is that correct? So there are minimal incisions made for the tools to insert. How many incisions? Probably there's one maybe a navel insertion, and then two other accompanying incisions made. I'm not sure. Did you?
Three. One is for the camera, and two for the
tools.
Hands.
Okay.
Tools. Yeah.
Now, so the camera includes a light source, right?
Yes.
All right. But I noticed that there's all this like area, and it's full of air that they're working in. Do they fill the abdomen with some kind of an air or something? Do they inflate the abdomen with a pocket of air so they can work in there? I don't know the details.
We use the CO2.
CO2? Okay.
Yeah, because CO2 can
it can be resorbed into the tissues.
Yeah, resolved to the vessel.
Yeah, in fact, oxygen may cause clotting.
Clotting means fire.
No, a thrombus.
Thrombus.
Yeah, oxygen would cause coagulation.
Oh, really?
Over-oxygenated blood would coagulate.
Coagulate?
Yeah, you would have thrombus in the blood vessels because it would be over-oxygenated. Like in the case of a wound, when you have a wound, and the coagulation begins, right? So I think you don't want to use oxygen or even air because you would risk coagulation or embolism. An embolism would be dangerous.
Believe in oxygen is in our blood.
Yeah, but oxygen entering the blood is handled through the lungs in a very fine tissue. The alveoli, the air sacs of the lungs handle that passively. We're not pumping high pressure oxygenated air into the tissues. So I think CO2 because of resorption, and you don't have issues. But that would require further study. I don't know anything more than that. Yeah.
But CO2 is more easily to resorb to the blood.
I guess so.
And also, if we use the oxygen, we use the electronic cutting.
Oh yeah, and you would have a risk of fire.
Yeah.
Yeah.
So we don't use the oxygen.
Okay, that makes sense. Time. But then again, why not air, right?
So there are the N2.
Oh, okay.
We don't want to.
You don't want nitrogen narcosis.
Mm-hmm.
Yeah. Okay.
And it's
nitrogen buildup
for blood.
Yeah, you don't want nitrogen buildup. Well, that could lead to embolism.
Mm-hmm, mm-hmm.
Yeah, you wouldn't want embolisms. Okay, great. Yeah, and the CO2 will be handled very well in the lungs. The CO2 will be transported through the bloodstream to the lungs, and it'll be exhaled.
Yeah.
So yeah, interesting. That's very interesting.
Mm-hmm.
So you've got the camera with the light, and then you've got the two hands.
Mm-hmm.
What do you use? Is it a separate tube for filling? There's a separate tube that's used to fill the cavity. Wow, that's
the cavity. The camera is.
It's like a multi-tool.
Light and fill the. How do you say that? Like straw.
Yeah. Okay. Yeah.
Filling the air.
Yeah, a little like a aquarium pump.
Mm-hmm.
You know, like a fish tank. What about suction?
Suction.
So, like, for example, in a dental procedure or other procedures, you have suction.
Yeah.
Is there suction?
You can change the tool.
Oh, nice.
And you can suction there.
Wow. So if you do have any bleeding, you can evacuate any bleeding.
Yes, but in this operation, there's
minimal bleeding.
Yeah.
That's it. That's amazing. Yeah. Just don't make a mistake.
Almost nothing.
It's almost no.
Now, I did not see any scalpels involved. I imagine it was only manipulators like clamps and then a suture for a needle for the suture, right?
Mm-hmm.
And needles generate minimal bleeding, whereas scalpels can generate bleeding. So,
but we use electronic scalpel.
Oh, and that's so self-cauterizing.
Mm-hmm.
All this great terminology.
Cutting and stopping the blood.
Self-cauterizing.
Self-cauterizing.
Yep.
Means
it stops the bleeding automatically. Cauterizing is like heat. You know, heat that stops the blood. Self-cauterizing.
Yeah, that one.
You know, back in the day, in the days of warfare, a man would have his arm chopped off and he's bleeding. They would put a sword over the fire and then cauterize his wound to stop his bleeding.
Mm-hmm.
Right? Fortunately, but then again, on the battlefield, tourniquets. We use tourniquets on a battlefield. Okay.
So thank you for the thing.
Yeah, thanks for sharing that. Dr. Aoki, do you have something for us?
Yeah, very good.
Yeah, good job.
Very informative, good discussion. Very important.
So I will check about the when the pain or something drains happen.
Sorry.
Yeah, I imagine that there's a risk of post-operative pain, right? So once she comes out of general anesthesia, she might be complaining of post-operative pain. So that neural block would be to prevent that, right?
And also, if you combine the local neural blockage and general anesthesia, you can reduce the amount of general anesthesia agent.
Oh, interesting.
Right. So the sedative level can be reduced because this is a very small, shorter duration. So the anesthetist usually doesn't want to use much amount of medicine.
And I imagine a child is such a low body weight that anesthesiology becomes very sensitive, very critical at such a low body weight.
In this case, the patient had a small surgery. The anesthetist has to wake her up after the operation immediately.
Okay.
So they don't want to use a lot of medication during the operation. That's why if you combine the medicine altogether, so it can be effective to reduce.
Okay, so this is compound anesthesiology. Ryotaro, I'm sorry, go ahead.
Depending on the place, different policies they have.
Okay.
So Nagasaki has a maybe different type of policy. In Osaka, the pediatric anesthetist usually they did the combined procedure.
Combined anesthesiology. Ryotaro, you are aware that medication is based on kilograms weight of the patient, right?
I need to check it because I didn't study.
From this.
Anesthesiology. I'm just curious. The anesthetists they did use the total intravenous anesthesia.
Oh, it wasn't respiratory.
Gas anesthesia.
Yeah, was it gas or was it IV in anesthesiology?
Only IV. Do you know that? You didn't notice.
There was gas.
Oh, it was gas anesthesiology. Okay.
Okay.
But I don't know. There was
intravenous.
Medicine.
Okay. Other than
maybe both.
Combined. I think they use usually fentanyl, remifentanil, this type of opioid for the pain management. But for the sedative purposes, they use usually gas for the pediatric patient. Sevoflurane or isoflurane, isoflurane or something like that. But of course, they can use propofol, midazolam, if you use IV.
If they use IV, So, Ryotaro, just to reiterate about kilograms weight for the patient and the drug load. Drug load is always based on, it's like milligrams per kilogram weight or micrograms per kilogram weight of the patient. And then there's what we call the half-life, which is basically the medicinal decay rate of the drug.
Yeah, right? I know it.
Yeah, so those are the major factors for administering medication. You will need to know the weight of the patient before you prescribe any medication because medications are the prescriptions are based on the kilogram weight of the patient. But then there are also age factors, right? And one common example would be aspirin not recommended for patients with fever under age 3. It's one specific example. I'm sure there are
3, I think.
What? I'm sorry?
Not only 3, I think. Aspirin.
Yeah, usually pediatrician doesn't don't prescribe aspirin.
That's just one specific case. I imagine there are many cases of medications that are not recommended for, certain age groups. Yeah.
Mm-hmm.
Yeah. So age is a factor, but the major factor is kilograms weight.
And also hepatic ability. How do you say that?
Oh yeah, the liver function.
Liver function.
Yeah, liver function. So
function.
patients with compromised liver function will then we're getting into half-life again. So half-life is because of metabolism. The drug is being eliminated through the liver, and patients with reduced liver function will have longer half-lives, right? Because they can't metabolize the substances in their blood.
Overdose.
And patient, go ahead. I'm sorry.
So the hepatic function is low. There are risk of overdose.
What would cause low hepatic function? What's wrong with my English? Liver function. Compromised liver function would be caused by, for example,
alcohol,
chronic alcohol use. Okay, prolonged alcohol use, abuse.
Heart function.
Does heart function affect the liver?
If the heart is weak.
Oh, so if they are, if it's circulatory issues, okay, like maybe bradycardia, or low blood pressure, right? Hypotension, congestive heart failure. Okay, all right. Okay.
And also, is there anything others?
I'm thinking hepatitis.
Yes.
Yeah.
Acute and chronic can cause cirrhosis eventually. And
poison victims,
also
like mushroom.
Autoimmune disease.
I'm sorry, I'm listening.
Autoimmune
disease, that's true.
Hepatitis. Yeah.
And poisoning.
Many.
Like mushrooms.
Mushroom poisoning. And also, I like the topic is the iron intoxication. Iron.
Oh, really? Iron intoxication.
Hemochromatosis.
What causes the iron intoxication?
For example, one good example is a chronic transfusion, like a blood disease.
Okay. Are you talking hemophilia?
Something like that. Not hemophilia. Hemophilia is not anemic disease, but like leukemia or other bone marrow disease.
I see.
So they need a chronic regular transfusion, and then iron can be accumulated to the body.
Wow.
So it's possible. And sometimes iron supplement is of course very available.
But some people take too many supplements.
Yeah.
Some people overdose on supplements. Yeah. Yeah, that's true. Yeah, all these things need to be considered.
And parasite disease.
Oh, okay.
Some parasites love to live in liver fluid.
Oh, are you serious? That's right. Oh, God.
Hydrated. Yeah.
Oh,
so
God.
Possible.
Yeah. Ooh. Well, that's where ivermectin comes in.
Yeah,
ivermectin's great on those. And a lot of those worms come from raw fish. So maybe Japanese people are more susceptible to that.
Yeah.
I had been living in Japan for like 25 years, and then the corona came, and so I took ivermectin orally, and I felt much better internally. I think I'd been accumulating parasites over the years by eating raw fish, and after my first ivermectin dose, I felt like this huge weight lifted off my body. I don't know whether that was placebo or in reality, but the second dose didn't do that for me. But my first dose of ivermectin, I just felt like a relief.
Maybe placebo.
I'm thinking I was suffering from a chronic parasite, and I think it may be more common in Japan than most people realize, because if they're not examined and they become accustomed, if it's a chronic condition, right? There's this, there's a what we call it chronic accommodation, where a patient needs to seek treatment, but they don't because they've become accustomed to their condition as if it's normal. And then upon examination, the doctor says, you've had this disease for over 10 years. Why didn't you see me earlier? Oh, I didn't know. Because the human body has a way of becoming accustomed to adverse conditions. Right? I believe in ivermectin. Seriously, it's a miracle drug. It really is. I seriously believe in it. Yeah. I think everybody should be given a yearly dose of ivermectin. It should be a nutritional supplement. You might try. Who likes to eat maguro? Who likes maguro? Yeah, be careful. You can accumulate parasites with regular diet of maguro. You can accumulate parasites. So be warned. Also, there's the mercury load. That's scary. Sweegine. I mean, it's so tempting and so tasty, but be warned. Ivermectin to the rescue. It's very low toxicity, very low side effect. Ivermectin is a wonderful medication. Cheap. Yeah. Okay. Where is everyone else? It's just the three of us today.
But my cannot.
That's fine.
Join, and also Mizuki cannot join.
I'm glad that the both of you were here. It was very nice having an expert opinion with us. Because when Ryotaro, it's only Ryotaro and I, we are medical students. We're not doctors. So there are many cases where, oh my God, I wish Dr. Aoki were here, or I wish Dr. Hayakawa were here to answer our questions.
Yeah,
so we have to speculate. It's good discussion, but having the expert on site, having the doctor car here with us, we got the trifecta. We call it the trifecta.
Yeah, this is a very good time to me also.
Thank you for joining.
Medical student knowledge.
Thank you for joining.
Very important. Sometimes I just forget everything not related.
It's a refresher course.
Yeah. Kind of test. Exam.
And then we're getting close to the Golden Week. Are we scheduled for next week, or is the Golden Week not a factor?
I think May 1st is
May Day.
No. April 30.
Oh, no problems. April 30.
April 30. Yeah, maybe next week is no problem. And in May, I think May 7th is also usual Saturday already.
Okay, I'm here. Rain or shine. Rain or shine, I'm here.
Maybe I cannot join the 7th May in May.
Okay.
We'll be thinking about you.
Okay, thank you.
Gentlemen, thank you for joining. I'm looking forward to our next time together.
Yeah, thank you for teaching me about medicine and English.
My pleasure. See you next time.
Thank you.
Bye.
Okay, take care.
Bye-bye. Thank you.
How are you, Fumiya? What are you working on? What are you working on? What are you working on?
I don't know.
You don't know what you're working on? I saw you had your phone. I think you were using Google Translate.
I try to Google. I try to speak Japanese to English.
What were you working on?
何言ってんだかわからない英語で言うと。
Okay. Specifically? Specifically?
Specifically.
What were you working on?
I'm watching YouTube.
Okay. So what was the word? What was the word? Was it a specific vocabulary word?
No.
Well, you can, if you remember, or you can show me, or you look on the phone, show me what you were working on.
I just trying it voice.
Yeah, what were you working on? This is what I was working on, okay? I was working on this. Vestigial. Vestigial.
Vestigial.
Yeah. How about you? What were you working on? Can you show me your Google search history?
No.
What were you working on? So just show me. Fumiya, it's not so complicated. Just show me your Google search or your translate history.
I don't use translation.
Oh, okay. Okay, so show what was your Google search?
I was watching YouTube and I watched BBC channel.
Okay.
I watched.
Yeah.
And the title was "Should I skip breakfast?"
Oh, really?
Is breakfast really the most important me?
Oh, is that right? That's interesting. Okay.
Interview.
Oh, okay.
Meeting.
All right. Thank you. Thanks for sharing. That was my question. In fact, the Google search will give you a history of your previous searches. Yeah, it'll show you what you've been working on. Very useful tool. All you need to do. Sorry, let me go home again. Yeah. So this is. I don't know if your Google search looks like this, but all you do is you go into the window and touch the window, and it'll give you a list of previous searches. Yeah. I've been working on this. I've been working on this. I've been working on this. Yeah. Good.
What are you working on? This one. Okay.
Yep.
I understood.
Good. Shall we check your homework?
Okay.
Were you in an automobile accident?
No.
Oh, okay. I thought maybe you were in an automobile accident.
I don't.
Do you have a good lawyer? Do you have a good insurance company?
I don't fell down.
Whiplash victim in court.
Down on a bicycle. I get so my neck suddenly. But so I went to yes. So
Are you hurt in an injury?
So I went to the clinic and checked my leg, and I ended up. I'm so sorry. The doctor said to me, it was hernia. Hernia.
Herniated disc, not a hernia.
Herniated.
Yeah, be careful. You have to be careful with that.
Herniated.
Sorry, one moment. Hernia. This is a hernia.
No hernia.
No, not a hernia. Herniated disc. This is a herniated disc. Yeah, be careful, because hernia is a different thing than a herniated disc. Yeah.
Herniated disc?
Yeah.
Sorry.
Yep.
Disc? Okay. I understand.
Japanese say hernia. I'm like, oh my God. And no, herniated disc. Okay.
Disc.
Yep.
Okay.
Yep. Good. Are you ready to check homework?
Yes.
Good.
President. Speaking of president.
The president of the United States?
Oh, Japanese.
Huh? Japan doesn't have a president. I'm sorry, Fumiya. Japan does not have a president. Do you know the title of the highest office in Japan? Fumiya, can you hear me?
Sorry.
Japan does not have a president. Do you know the title of the highest office in Japan?
Japanese Prime Minister.
Exactly. Thank you. Evidently, Korea has a prime minister and a president. I don't know how that works. That must be very confusing. "22th."
Second. Sorry.
Yep. That's why I asked the students to do that, because it's very, very common mistake.
Sorry.
Yeah.
Second. Sorry.
It's a Zenkoku mondai. Please put a space after the comma.
Sorry. Space. One space.
Yeah. Indifference. credible.
信頼できる
credible, credible,
credible
test. Indifferent,
indifference difference
contempt, oh, oh,
Page 1. Switch your brain on. Okay. Good work, Fumiya. I'm so glad you take the homework more seriously now. It's also easier to read the typed pages.
Thank you.
Thank you. Oh. Can you see my screen?
Yes.
Thank you.
Wednesday, April 22nd. The title is the Japanese Prime Minister. I'd like to talk about the Japanese Prime Minister Sanae Takaichi. Actually, I don't have any idea of her because I have neither respect nor contempt.
Contempt?
Contempt.
Oh, okay.
Rather indifference.
Okay.
Even if I do something in the government, it won't change anything. So of course, I'm definitely never going to run for office. But it's not like I don't vote.
Okay.
Before voting, I check who's running, their policies, and whether they are
credible.
Credible. But I don't have any hope for government because even when the members change, suddenly my life, my plans for the weekend, and my future won't change because everything depends on me.
Oh, good. Self-determination.
Like Gandhi's famous policy on non-violence and civil disobedience.
Civil disobedience.
Civil disobedience.
Okay.
Now I'm focusing on my paper. I want to send it to Dr. Yamamoto by the end of this month. I'll speak about my research in the conference this September in Oita. So I have to submit my work by this June.
Okay.
I'm not good at writing, but I want to work more quickly and keep my concentration longer.
I see.
So I changed my morning routine.
Do you have a question?
No.
That's good work, Fumiya. Did you have questions from last week? No?
No.
Yeah, just make sure you're careful when you're doing the rewriting. And if you do have questions, you can ask me next week. All right, good.
I used to get up at 5:50, and start homework.
Not homework.
Housework.
Yes.
Okay. At 6:20. I'd have breakfast at 6:50, giving me only 30 minutes to walk in morning.
In the morning. Sorry,
In
I
the
missed
morning.
that. Yeah.
Right, yes. So I thought I should get up earlier. So I started getting up at 5
Mm.
this Monday.
Congratulations.
As soon as I get up, I jog for 15 minutes.
Mm.
Then I start walking.
Ah.
It's walking.
I shouldn't say that. I start working. I think now things are better. Now things are better.
Mm.
Yeah.
Sure.
I made a mistake because you say I start working. We say it's working or my new routine is working, but I don't want to use working twice in the next sentence. So I would say now things are better. Do you understand?
Then start walking.
No. Now things are better.
Where?
Okay. So you say I start working and I said it's working, but that's not good because we have the word working and working right next to each other. It's not a good choice. We don't want to use the same word twice so close together. You said these habits make me better. Well, we don't say that in English. It's not a common phrase. There are other ways we could say that. We could say it's working. My new habits are good for me. Now things are better. I think now things are better is a good choice for that. Yeah.
Except for it's working.
No. Now things are better. Okay.
It's working.
Well, because we have I start working and it's working, we need to change that. So now things are better is a better choice for that.
I start working things.
Now things are better. Be careful.
So now things are better.
There you go.
Okay.
Thank you.
I start working now. Things are better.
Good.
Okay.
Yeah.
Many people working.
I'm sorry. Slow down.
Not many people say working out is important to switch their brain on.
Yep. Switch their brains on, people. Switch their brains on. We have many people, not just one brain. So many people say working out is important to switch their brains on.
Brains on.
Yeah, because many people, right? Not just one brain. Are you okay?
Okay.
That's good, Fumiya. You're taking this much more seriously. And if you do the rewriting properly, this should really help you. I'm sorry for my mistakes, but I work as fast as possible. And I always make a mistake. But we catch them when you read it. So, do you have a question here?
No question.
That's good work. Did you see this thing I sent you? Yeah, this is incredible.
K is what? K.
Thousands of dollars. Luxembourg is off the scale, but it's a very small country. Right? It's a very small country. Norway is a bigger country with more people. So they spend more money than than these other countries because they have more people. The United States probably spends the largest amount of money on education because we have over 300 million people, right? Are you following?
No.
Do you have a question?
Sorry.
Yeah. Do you see this line that says average?
Average.
Yeah. Okay, down. Who's average? Finland is average. Japan below average. What? Now, what we have here is a phenomenon we would call the bench or the drop or the dip. Do you see the difference between Australia and Ireland?
Australia, Ireland.
Do you see that? The difference between Australia and Ireland? This is a trend here. Australia, Sweden, Germany, Iceland, Netherlands, they have a very similar number. But when you get to Ireland, then there's a drop. Do you see what I'm talking about? It's not a smooth line.
Ireland.
You're very quiet. Do you see Australia?
Yeah.
Do you see Ireland? Do you see
Yes.
the big jump there? It's not a smooth line. Do you see these? There's kind of a smooth line. Like if we go between Denmark and Sweden, it's pretty smooth, right? But when we get to Ireland, it falls off a cliff. Yeah. And every country below Ireland is kind of in a sad place. And it's very sad to see Japan so far behind. Below world average is very, very sad thing to see. Yeah. Oh, where's China? Where is China?
No China.
What? No China? Oh my God! Oh, they're in. Oh no. Oh no. Poor China. The largest country in the world spends the least amount of money on education. And where's India? I'm looking for India. Huh? Oh, they're not even on the chart? What? Oh no. You were talking about Gandhi. India's not even on the chart. Oh no. The two most populous countries in this world don't care about education. Luxembourg's probably one of the smallest countries on earth, and they spend the largest amount per person on education. That's so interesting. I thought this was something we could talk about a little bit. Do you have an opinion about this?
Number one is what? The country.
Luxembourg is a very tiny country. They have a very small population.
Luxembourg.
Yeah, it's a very small country in Europe. They have a very small population, right?
Oh, small population. Oh. Much more money to spend than other countries.
Well, but you really can't count that as a country because the population is so small. What I would focus on is the difference between economies. Which country has the largest economy in the world?
in the world? India,
No.
China.
No.
Economy. I don't know. Sorry.
In dollars per year. You know, how many dollars does the country make every year? How much oil do they sell? How many computers do they make? How many cars do they deliver? How many jobs and people and tall buildings and machines and computer companies? You know, which country is the dominant economic country in the world? What is the number one economy on earth? The United States. Yeah, exactly. So the United States should be near the top. No excuse, right? And the United States on this graph is number 4. Okay, that's not bad. What is the number 2 economy in the world?
It's China. No,
Yep,
no China.
it is China.
Oh, it is China.
Used to be Japan.
Oh.
But about 20 years ago, China passed Japan on economic scale. Japan used to be the number 2 economy. Okay. Now, this is unexcusable because, well, maybe not. They have 5 times the population of the United States. So it's very difficult to spend money on a billion, 1.5 billion people. You understand? They have the largest population, right? So even though they're the number 2 economy, they're the number 1 largest country.
China.
Yeah, so it's going to be difficult to spend a lot of money on education when you have so many people. Maybe we should consider the number 3 and 4 economies. Okay. America is kind of, well, Luxembourg, it's too small. Not a good example. Right? America is a very rich country with a small population. So not a good example. China is a very huge population. Not a good example. Let's look at number 3 and 4. America's number 1, China's number 2, but not good examples. America makes too much money and China has too many people, so not a good example. Do you follow me? Okay, so let's say you're taking data, right? Let's say you're doing a research. You're doing data. You're collecting data in the laboratory, okay? And you get these data points, and the data points kind of follow a line or a curve, and you'll get boop. Oh wait, what's this? It's a mistake. It's an outlier in the data. Something was wrong with the equipment. There was some problem. So we'll throw it out. So in many cases in a data trend, the highest number and the lowest number are excluded because it's not part of the data. They are outliers. So we could consider the United States as an outlier and China as an outlier because the United States is too rich and China has too many people. So if we go to number 3 and 4, we're back in the normal zone. Good. I think you follow me now. Thank you. What are the number 3 and 4 economies?
Korea.
Nope.
Japan.
And
Japan.
I'll give you a hint. Richest country in Europe.
Poland.
No.
Germany.
Yes. Think BMW, Mercedes-Benz, Siemens. Yeah, okay. All right. Now let's go back to the graph. Where is Germany? Where is Japan? Not good. Germany's way up here. Japan's way down here. Not good.
Not good. Japan is not good.
In fact, Japan and Germany typically number 3, number 4, they trade places as number 3 economy, number 4 economy. Their economies are so close.
Yeah.
Right? Oh, but wait a minute. What is the population of Germany? I don't know what it is. What is the population of Germany? Oh, God. It's less than Japan. 83 million. Japan has something like 130 million? Okay. Maybe Japan has too many people.
Too many people?
Well, but not that many children.
Not many.
Yeah,
children.
so it should be easy to spend money on fewer children. Right? Yeah. Do you think Japan has too many selfish old people? Selfish old people.
Selfish people.
Selfish old people. Selfish old people. Try again.
Selfish old people.
Old people. Yeah. Do you think Japan has too many selfish old people?
I think so.
I think so too.
Same opinion.
I have many doctors and medical professionals like you, and I ask them, because Japan has had a very sad economy recently. When will Japanese economy improve? And they say, when the baby boomers die. Baby boomers. Baby boomers. Do you know baby boomers?
No. Baby boomer.
No, baby boomers.
Baby boomer.
No, boomers. They're boomers.
Huh? Baby boomer.
Boomers.
Baby boomer.
Japanese demographics.
Baby boomers.
Japanese say what are Japanese called baby boomers? Huh? I'm sorry. I can't see it. I can't see it. Dankai no Sedai. Okay.
Baby boomers.
Yeah, and where are the baby boomers? I guess they're here. These are the baby boomers, and these are their children. So we have two problems: the baby boomers and their children. Okay. Yeah. They say when the baby boomers die, then Japan's economy can improve. That's not me, not my words. These are doctors, right? Clinic owners, university, hospital university presidents, hospital heads, department heads, surgeons, lecturers. Yeah, they tell me when the baby boomers die, then the Japanese economy can improve. Selfish old people should die. I didn't say that's not my words.
Bring them to trash box. Sorry. Okay.
Wouldn't it be better if they just acted more responsibly? Right? Yeah.
Japanese babies
Birth rate?
birth rate is
Yeah.
decrease.
Yeah.
Decrease.
And I think it's because the grandparents are so selfish. Yeah. It's really sad.
I want to make babies in some countries.
Oh, you want to have a family in another country? Maybe you and your girlfriend could move to America. Not now. Immigration is very restricted in America now. Biden was so terrible. He let millions of people in the country without checking their papers. It ruined the immigration system. So when Trump came in, they just shut down everything. You know, something like, while Biden was president, 25 million illegal people flooded into the country, and it ruined our economy. And so Trump was like, shut it down. Just shut it down. We've had 4 years of craziness, and so now is not the time to move to America unless you're rich. If you have $1 million, you can buy a Trump card and get a gold card. But if you're just a regular working person, no. Maybe Australia. You want to live in Australia?
Norway. How about Norway?
Do you speak Norwegian? Do you like ice fishing?
No.
If you had a chance to live outside of Japan, where would you go?
New Zealand.
Sounds nice. Sounds very nice.
Saying is easy.
Yeah, well, you could have a sheep farm and 10 children. Yeah.
I want to go to there.
Yeah.
But I haven't been to there.
It's very popular with Japanese people. It's like a geographic time machine. If you could go back 2,000 years, Japan would look like New Zealand. It's an island chain, lots of coastline, lots of mountains. It's almost like a time machine for Japan 2,000 years ago. Before the wars, the urbanization, right? The pollution, the trains and cities and highways and cars and noise. Just the natural beauty.
Natural beauty.
Yeah.
I like this.
And especially somebody who lives in Tokyo. Now it's not so bad for me because Osaka Jokoen, I look out my window, I see green every day, right? I live in a nice part of Osaka. But if I lived in Higashi Osaka, or if I lived in Hiranoku or Juso or some awful place like that, there's a lot of places in Osaka that are it's just concrete and asphalt and buildings and roads and cars. It's so sad. But this area, it's kind of nice. I look out my window, I see the green, the park. My daughter and I, we fly kites, you know, in the park, and it's kind of nice, this area. But
I'm gonna move to somewhere lots of green.
Well, I think Sumiko lives in a nice area, but she's a rich woman. She's a professor. Her grandfather was a steel magnate. So I don't think you'll have a chance to live. What is the area? Where does she live? I forget the name of her area. Sumiko Yamamoto, Dr. Yamamoto's What's her neighbor? I don't know anything about Tokyo. Where does Sumiko live?
Setagaya.
Is that nice, Setagaya? Lots of green space. Big, beautiful, expensive homes. Yeah, sorry. This area is not expensive. This is Danchi. I live in the projects. But luckily, it's near the castle. So you could not find this type of location in New York City. New York City has Central Park, right? There are no cheap places to live near Central Park in New York. The closer you get to Central Park, the prices go out of reach. But here in Osaka, near our Central Park, I live in this Danchi area. It's cheap. So lucky. I'm lucky. Yeah. Setagaya sounds expensive. Yeah.
My rural city.
Your hometown?
Hometown.
Yeah.
Hometown is Tama City.
Tama.
It is very rural area.
Okay.
And lots of green.
Is it Tama? Where is Tama?
Do you know Hachioji?
So it's in Tokyo.
Yeah.
Okay. How far is it by train from central Tokyo?
It takes 30 minutes.
By train?
Yes.
Okay.
By train.
10 minutes on a bicycle, I'm in central Osaka.
Oh.
I'm in Honmachi in 10 minutes on a bicycle. Yeah. So I'm lucky. But most people are not so lucky. If they're rich, they live in a nice area. If they're not rich, they live far from their office and they spend a lot of time on the train. I'm not going to be rich, but I'm not going to do that either. I have a student that lives in Nara and they work in Kobe. They spend 90 minutes one way, 3 hours every day in the train. That's crazy. 3 hours a day in the train every day.
3 hours? Wow. I don't want to do that.
Well, a lot of Tokyo workers live in Yokohama or Kanagawa.
Yeah.
And they spend 2 hours in the train every day.
2 hours.
Yeah.
I don't want to do that.
No, I don't either.
Traffic.
No.
Many people use same train. So
Too many people.
Too many people.
Too many people.
Crowd.
Oh, yeah. Plus the tourists with their big suitcases. Come on, Takaichi. We're back to the Prime Minister. Why don't they charge money for those big suitcases? Like 100 yen extra for your ticket. Every suitcase, 100 yen. Right? The tourists, they should be taxed more money. They're using the system. Right? Tax the tourists so we can pay for better education. Right? Charge the tourists money for their big suitcases so that our tickets are cheaper. Right? The people that live here. I'm not a tourist. The Prime Minister was supposed to change these things, but nothing has changed. The name has changed, but the country stays the same.
Same.
Yeah.
My life isn't gonna change. It depends on me. Yeah.
There you go. I like that attitude.
Yeah.
I also like your new attitude on the homework. Before you were writing in the notebook and you weren't very serious. You know, you would scribble some sentences and lots of scratching out but you were just getting started, so I wasn't worried. But now that you're typing, you're much more serious about the homework. And I'm seeing better work now. And I think your improvement is going to increase. So that's good work, Fumiya. Thank you.
Do you know, by the way, do you know the Goggins? Sorry, Goggins. David Goggins. Do you know?
Who?
David Goggins.
Who's that?
Navy SEALs.
He was a Navy SEAL?
Navy SEAL.
Okay.
Americans motivation speaker. Do you know?
Oh, I don't. Yeah, okay. Like me?
Yeah.
Like me? Okay.
Yes. His YouTube. Make me.
Is motivating.
Yeah. This motivated is
Nice.
very high.
In English.
Actually, I speak. I watch on YouTube in Japanese. Actually,
You should listen in English.
too fast because
Slow it down.
So okay.
Slow down the English. Yeah.
Keep practicing. Practicing.
Yeah.
He said.
Yeah, exactly.
The brain is changed.
Yep. Change your brain.
So base is higher.
Change your head and your ass will follow.
I don't know. Sorry.
Change your mind and your ass will follow.
Also follow.
The tail of the snake follows the head. The tail of the snake follows the head. Not the other way. The tail of the snake follows the head. The tail of the snake follows the head of the snake. Yeah, okay. Yeah, good. Challenge yourself to listen to his program in English and turn the speed down if you need to.
Okay.
Yeah, step by step. Fumiya, good work today. Thank you very much. Good writing. Any questions? So, do we have a class next week? Yes or no?
Yes.
And so, what about the 7th of May? No?
May 7th, not.
May 7th is a holiday. So, yeah, next week. I'll see you next week.
Okay.
All right, Fumiya. Any questions, just send me a message.
Thank you.
All right, thank you very much. Take care. Where's Daichi? All right, Daichi. Wow. Plymouth. Where the fuck is Plymouth? Daichi, where are you? There you are. Daichi, how are you?
Hi, I'm good.
Good to see you. You want to talk about the Vietnam War?
Yeah,
Why?
because today is Army Reserve Day.
I'm sorry?
Today is Army Reserve Day.
Army Reserve Day? In Japan?
No, I don't think it's in Japan, but
Are you sure it's called Army Reserve Day?
I think so.
One moment. Is that a Japanese translation?
No, it was like
Army
straight from
Reserve
Japan.
Day. Reserves Day 2026 celebrated Wednesday, June 24th. Sorry. Oh, that's a British holiday. U.S. Army Reserve Day, April 23rd. Oh, yeah, the U.S. Army Reserve, founded in 1908. Okay, Army Reserve, yeah. Warrior citizens. Japanese say shiminhei.
So like they used to be like civilians.
Well, they are civilians. Not used to be.
Oh.
We have another term. We call them weekend warriors. So one weekend a month, they go off and they train. They drive their tanks around. They shoot their guns. They fly their helicopters, right? And then the rest of the time, they go back. They have a regular job. Pilots, doctors, teachers. Yeah. And then once a year, they spend 2 weeks doing a summer camp. They have intensive training 2 weeks every summer.
Oh, okay. It's like a boot camp.
No, it's I don't want to. It's a refresher training. It's just to keep them, in skill, so that if there's a serious emergency, how do I explain this? We have dedicated full-time soldiers, dedicated full-time military, right? Like Japan.
Yeah.
And then we have everybody else. And if there's some kind of an emergency, you have to get all these everybody else's into the military. It takes 3 months to train a person to use a weapon system. In 3 months, everybody could be dead. I mean, you could be taken over by the enemy in 3 months. So by having this kind of a emergency, it's kind of you know what the shobodan is?
Oh yeah.
The guys that like one weekend a month they go practice with fire hoses and that kind of thing. They drive the fire truck around and right, they take classes and that kind of thing. It's all volunteer. In case there's a fire, they're ready. Okay.
Oh yeah.
Yeah. So you have this kind of what we call a stopgap. You have these people that they don't want to leave their family. They don't want to be in the Gulf. They don't want to be in Okinawa. They don't want to be in Germany. And then they like their job, right? They got a good job. They don't need more money. They don't need to join the military, but the military needs people like, hey, we might need you in an emergency. And so we have this category called the reserves. It's like in between full-time military and just a regular civilian. And it's like in case of emergency, like a shobodan, like what we call the fire brigade. They're not real firemen. They have other jobs. But if there is a fire, okay, they're ready.
Okay.
Yeah, very important. Where did you learn that today was Reserve Day?
I just searched.
Oh, okay. It was on the Google search or something. Yeah.
Oh yeah.
Yeah, Vietnam War. Let's talk about it.
Okay.
A lot of reservists died in that war.
Oh yeah.
Yeah. I was a reservist. Well, you're not a reservist now.
Good. That's not true.
I had a life. Well, you don't have a life now. You're in the army now. You're not behind the plow. You'll never get rich, you son of a bitch. You're in the army now. Oops. Sorry.
Is that like the song?
They add words to those things. The army has this bugler and everything means something different, like get up, go to bed, eat, form up. Right?
Oh,
They used to communicate everything with a trumpet before there were loudspeakers and radios and electronics. They had a guy in a bugle. The bugle commands, every bugle command meant something different. That might be interesting. I kind of like this.
Like I heard that like when you charge.
Yeah. That's the charge command.
Oh yeah.
I wasn't in the army, but army bugle commands. Oh, that's is this everything? Reveille on bugle, West Point band, mess call. Bugler sounds charge. Bugle calls, cavalry charge in first call, 27 seconds. Reveille, assembly, bugle calls on trumpet. Bugles in military history. Bugle calls of the U.S. military, 20 videos. Oh, here we go. This is what we're looking for.
Yeah.
Okay, let's see if you can hear it. We had a hard time hearing it last time.
Oh yeah.
Can you hear it?
No.
You can. Okay, I think I did something wrong. I have to
It's like the audio thing.
No, I think. Stop sharing. I'm going to share again. This time, I think I need to click this button. Also share your device's audio. Can you see my screen?
I can see your.
What the hell?
If it was still the audio, if it was.
I'm gonna try again. Also, share your devices. Are you continue? Start broadcast. Okay, I just didn't push the right button.
Oh yeah, I can see it.
All right, you can see the screen, and let's see if you can hear. Try one more time. Can you hear it?
Oh yeah, I can hear it.
Yeah, I just need to click that button. Do you know what this means?
No.
It means wake up.
Oh, okay.
It doesn't just mean wake up. It means wake the hell up. Now.
Uh-oh.
Right? You should have your boots on 30 seconds ago. Wake up. Okay?
Oh yeah.
Thank you. All right. Do you know what this means?
No. I've heard it somewhere though.
It means go to bed, or it's played when someone dies.
Oh dang.
Yeah.
I got the bad vibes.
Yeah. All right. Now we're getting into some interesting things I don't quite understand. Attention, there's going to be some kind of announcement. So here's attention. Oh, I remember that one. And then the cannon, boom, and then they would raise the flag, and you had to stop, turn, face the music, and the flag would go up. You stop what you're doing, you stand up, you turn and face the music, and you stand at attention. You understand the position of attention?
Yeah.
Like when soldiers stand with their arms to their side and face forward. Yeah, okay. That's a simple one. Well, I'm sorry, one more time. Yep. That's what the horse tracks use when they're getting ready to run the race. First call.
Wow.
Well, the men have some time in the morning to get ready, like eat breakfast and all that stuff. And then first call sounds, you got to drop your breakfast and get in formation.
Oh.
You come together in the formation. Recall. What is recall? I think recall was used when the men were out fighting, but they wanted them to reform back at the commander. So they would, if they heard this recall, they would move back to where the sound of the music was coming from.
Oh.
In other words, it's like, we've won, give up fighting because they're dead and come back. Stop raping the women, right?
Oh, okay.
Do you know what this means, mess call?
Mess call? No.
Go to lunch. The food's ready.
Oh.
The mess hall is where they eat.
Oh, yeah.
And mess call means the food is ready. I'm hungry. Adjutant's call. I have no idea what this means. I think that's when they wanted the officers to meet at the command post. The men could keep working or doing what they were doing, but they wanted the officers to go for a special meeting because they had orders for them or something. Yeah. This is when they raise the flag. So on the military base, first you will hear attention. Stop what you're doing. And the flag goes up, and you salute the flag as it goes up the pole. Yeah.
Like a combo.
Yeah, the attention. Stop what you're doing. The cars would stop driving down the street. And the flag would go up. Yeah, echo taps.
It's kind of like sad.
Yeah, but what's the difference between taps and echo taps? Is there a difference in meaning? I'm going to ask the Google because it's hurting my brain.
Yeah.
What's the difference between taps and echo taps? It's so sad that echo taps makes you want to cry. Also known as silver taps, unofficially highly emotional variation. Wow. Okay. Have no idea. I have no idea. This means run away.
Retreat.
Yeah, get the heck out of the way.
Oh.
This is when the flag goes down.
Okay.
Oh, it's so quiet. It's so quiet, it's hard to hear. Oh, why did it get so quiet? I think it's a problem with their recording. Yeah, that's for some. They had some problem with their recording. Anyway, we learned something.
That's cool.
And then, of course, with the modern electronics and loudspeakers and that kind of a thing, now we got internet, but in the past, the bugle was an important way to communicate with the soldiers.
Oh.
Yeah.
When did it stop?
Well, it's still used on the military bases.
Oh.
Yeah, but only for like when the flag goes up, the flag goes down, or when it's time to go to bed, that kind of thing. Just it's just kind of ceremonial.
Yeah, it's kind of like a tradition.
Yeah, it's traditional. But in the past, it was a necessary part of communicating on the battlefield.
Oh.
Yeah.
Okay.
I think things changed when modern explosives started being used, right? When it's just men on horses with their swords, you could actually hear the trumpet. But when bombs and guns got involved, it's like, what? Trumpet? I can't hear a goddamn thing. Right? Yeah, things have changed. Yeah. You could pretty much blame the machine gun. No more horses, no more buglers. Yeah. Okay. Let's talk about the Vietnam War.
Okay.
That was interesting. I learned something.
Oh, yeah.
Oh, yeah. Army Reserve Day. I wasn't in the reserve. I wasn't in the Army, so.
Oh.
What do I know about the Army? Nothing. I had a friend that was in the Army Reserve.
Oh.
I think he was in the National. I think he was in the National Guard. I don't think he was in the Army. I think it was National Guard, which is a bit different.
National Guard.
Yeah, that's a little bit different.
Kind of like the Royal Guards.
No, the Royal Guards are part of the King. That's the British Army.
Oh, yeah.
Yeah, the National Guard is basically the army, but they don't go overseas. They don't spend time in Germany.
Oh.
They're called up. They're like the reserves, but they're called up when there's a hurricane or a flood, that kind of thing. They make sandbags to protect the town and all that kind of stuff. Okay.
Okay.
I heard it. Yeah, that's scary. Vietnam. Human waste.
Oh, okay.
Brutal. That's the only way to describe it. Brutal.
Yeah.
What was it? 19 years long? It's insane.
It's pretty long.
Yeah, it was insanity.
Oh, I got it.
Right on.
Okay. Thursday, April 23rd, Vietnam War. Today is Army Reserve Day. A day to appreciate the service of reserve soldiers. During the Vietnam War, a lot of Americans were called into military service. Here are some facts about the war you probably didn't know. 1. The Vietnamese soldiers could be anywhere. Villages, jungles, even disguised as civilians. This created constant tension and fear and made traditional military strategies less effective. 2. Helicopters were used to move troops quickly over jungle terrain, which allowed rapid medical evacuation. Okay, 3. One of the most infamous traps was the bungee stake trap. A hidden pit filled with sharpened bamboo spikes, sometimes coated with dirt or human waste to increase the risk of infection. The Vietnam War was brutal.
Yeah, the booby traps.
Yep.
Booby traps. You have any questions?
No, I'm good.
I must recommend. I don't know how you would watch this. I don't know if you'd have to buy it on Amazon Video or something, but it's Ken Burns. Do you know about Ken Burns? Yeah, Ken Burns Vietnam. There it is right there.
Ken Burns.
Oh, wait a minute. Wait a minute. Are they going to have the full thing on here? Oh my God, here it is.
Is it like a movie?
It's a documentary.
Whoa.
Is this it? Is this it? Although the quality might be low. Is this the Ken Burns documentary of Vietnam? I wonder. There have been a lot of documentaries of the Vietnam War. So I don't know if this is the Ken Burns Vietnam War documentary. No, it's called Battlefield Vietnam, which is probably a good one. Yeah, and it's 12 part. It's not the Ken Burns one, but there's a lot of good. Ken Burns, The Vietnam War, 9 videos. Got to start at number 1. Oh no, this is back to that same.
Yeah.
It's not the official one. They just gave it the
Oh,
this. Maybe this is it. I think this is the one. Yes, this is it. Yeah, because each one is over an hour long.
whoa.
Yeah. This video contains content for PBS who has blocked it in your country on copyright grounds. Thank you, PBS, for not supporting those of us who live in Japan. Why? Do you have a VPN?
I think I do.
So I'm going to send you the link to this. Okay.
Okay.
Can I send a link? How do I send a link? I don't know if I can send a link. Oh yeah, there we go. Share. I'm going to share the playlist with you.
Okay.
Wait a minute. I'm going to share it to your mom's email address. That's better.
All right.
That's your mom's email, right?
Oh, yes.
Yeah. If you have a VPN and you can set your VPN to the United States, then you can watch it on your iPad.
Oh, okay. Gosh.
Wait a minute. What about this one? Is that number one? There is no single truth in war. What? Why is it?
General studies. Mark began his studies at Columbia in 2013.
I don't know what's up with that. That's not it. This looks like it's almost it. What's going on with this one? 6 of 12, 1 of 12, 6 of 12, 3 of 12. Gosh, YouTube is kind of a...
There's a lot of stuff.
Well, what is up with these people talking about?
But now someone honks the horn.
Oh, here we go. This is the first 20 minutes they interview. Oh, that's Ken Burns. He's the one that made it. So this is just kind of a talk before it begins. And it begins right here at 38 minutes. Episode 8. I want to see episode 1.
It did more than piss us off. It broke our hearts. What were they thinking?
Blocked on copyright grounds. Yeah, that's really sad. Yeah. The public television service of the United States doesn't believe that Japan should be educated. So the last link I sent you, if you set your VPN to the United States, you should be able to watch it.
Okay.
Can I just get a trailer? Is this a trailer about it? I think this is the trailer.
There's a trailer.
Yeah, the trailer is just kind of like an advertisement. Yeah, this is the intro to it. Nothing was recreated. There were no actors, no Hollywood special effects. Right? These are all films and photographs from the time. Those are the Marines.
Oh.
Yeah.
Okay, that's cool.
So this was life in America during the war. And this was, yeah, They're going back and forth. They're going back and forth between what it was like in America and then what it was like in the Vietnam. And these guys were there.
Yeah.
They were there. They fought.
Oh.
So I was 3 years old. I was just like one of those kids, but these guys were there. And
Damn.
yeah, it was brutal. I mean, damn. Imagine. Why is his head down?
Yeah.
Because he doesn't want to get shot. Yeah. Oh, they're going backwards. If you could take it all back. That was the day we lost. Yeah, pretty amazing stuff.
Yeah.
Yeah. Pretty amazing.
They kind of have the same uniform as like the World War II.
Oh, that's an interesting point.
I don't know. Maybe
No,
they
that's a
don't.
very interesting point. Let's check that out. U.S. Let's talk about the evolution
Oh yeah.
of U.S. military and I don't OS. No, sorry, pushed the wrong button. And I want to know, I don't just want to know about the dress uniforms, but the combat uniforms. Because I don't really care about the hats and all of that stuff.
Oh yeah.
Let's see if we can get. Because yeah, look at this. Things got
Whoa.
serious, right?
Yeah.
Back in the day, it was like, we look better than you. Look at my fancy buttons, and I'm so brave, and you're going to die, and I'm not. To, man, I need night vision. I need to blend in with the trees, right?
Yeah.
I need something that can shoot in the dark, and you know, it was like
tactical stuff.
yeah, because here's kind of a breakdown. Evolution of a hero. Wow. American Revolution. War of 1812. Yeah, things were, but then things got more practical, right? Pretty quickly.
Yeah.
Like, forget about the red, white, and blue. I need to carry my gear with me. World War I, helmets became a thing, right? It wasn't until machine guns and heavy artillery, and then this is World War II, Korean War, Vietnam War. There we go. This is what you're talking about, right?
Oh yeah.
Yeah, the Vietnam was not so much different than, it's pretty much the same helmet as World War II.
Oh yeah.
The rifle changed, right?
And like the jackets.
Well, now here's the thing about the difference between Korea and Vietnam. Korea was damn cold, and Vietnam it was damn hot. What are you gonna say? Wear the same gear in two different climates, right? Didn't make a lot of sense. Meanwhile, the Vietnamese soldiers were in sandals and pajamas.
Whoa.
Because it was more important to be able to move around quickly than to try to protect yourself with your clothing.
Yeah.
Yeah, okay. Then we move into my era.
Oh yeah.
Which is basically at the beginning, right? So I was right in the middle there, but between, we had new helmets, no more metal helmets. We moved into actually in training we had metal helmets, but then in the fleet we had the Kevlar. If you know what Kevlar is, helmets.
Like a bulletproof.
It's a bulletproof. It's lighter weight, and it's better at stopping a bullet. But things got more sophisticated with night vision goggles, and now they have audio equipment. Yeah.
Yeah.
Yeah. So they're pretty sophisticated technology.
Yeah.
Right? Of course, if you contrast the very newest to the very oldest, it's like, what?
There's a big difference.
What? Same people. Yeah. Yeah, this is a good one.
Oh yeah.
Yeah.
It was like all white.
I'm sorry?
It's like the Afghanistan uniform kind of looks white. You know, like.
Well, they don't really have the colors right. I mean,
Yeah.
if you're in the desert, you want to be sandy colored. If you're in the mountains and the trees, you want to blend in with the forest, right?
Yeah.
Yeah. The whole thing about the camouflage pattern in Vietnam, only special forces wore the camouflage pattern.
Oh.
Yeah.
I kind of heard about the Delta forces.
Yeah, those are special forces.
Oh yeah.
Yeah, this is interesting topic. So it would be Vietnam Special Forces. Yeah, they wore berets and the camouflage.
Oh.
And they were involved in training the local people how to fight. The special forces guys wore that camouflage. Yeah. They didn't wear helmets. That's Vietnam today, not the U.S. I would have to say U.S. Special Forces in Vietnam. There we go.
They have like the face paint to like.
Well, anybody can wear this face paint, but the U.S. Special Forces guy wore camouflage, whereas the regular soldiers didn't. Yeah, he's a Special Forces guy. Green berets, yeah, in Vietnam. Scary.
Yeah.
There's one movie you might be interested in. Have you ever seen the movie? Have you ever seen this movie, Apocalypse Now?
Oh no.
Yeah.
It's like set in the Vietnam War.
Yeah, it's a Vietnam War movie. That's the director making the movie.
Whoa.
Yeah, it was a good movie. It was pretty special film. If you have a chance to see that one.
Yeah, I will. Is it like on Netflix or?
Maybe. Yeah, you might be able to find it.
Yeah.
You might be able to find it. Okay, let's discuss. Recently, there's been a lot of global unrest. We have all of this, military activity in Iran. We have this Strait of Hormuz blockade, the price of oil. And I understand recently Japan is accepting half full oil tankers because the oil tankers can't fill because they can't get in and out of Iran. So they're coming to Japan half full. Japan says, bring them, we need it. So just bring it anyway. Evidently, Donald Trump asked Japan to help. Japan said no.
They said no.
Evidently, according to the President of the United States. My experience with the President of the United States, if there's something he can't say, he just won't say it. He won't lie. Right?
Yeah.
But sometimes he can't say something. Like when the press asks him a question, he's like, I can't tell you that. I can't tell you. I can't reveal my war plans. But if he does say something, it's true, right? And according to the President of the United States, when he asked Japan for help, they said no.
What happened to the alliance?
What happened to the alliance? Good question. It's not really an alliance. NATO is an alliance, okay. Of course, when the president asked NATO for help, they said no too, right? But what's the point? The Japanese relationship with the United States is not an alliance. It's an agreement. Okay. The United States promises to defend Japan because has promised since 1945.
Oh yeah.
So the United States in its war with Japan between 41 and 45, 1941 and 1945, destroyed most of the Japanese military. Okay. And then when Japan surrendered and the war ended, the United States worked to eliminate the remainder of the Japanese military. Okay. So two big events, Hiroshima, Nagasaki, then the surrender. Okay. The speech by the emperor over the radio. We must endure the unendurable. Okay. Are you familiar with that? Okay.
Oh, yeah.
Are you familiar with the battleship in Tokyo Bay with the prime minister signing the paperwork? Okay. Officially ended. Here comes America. America was busy here for 10 years. First of all, there's a power vacuum. Suddenly Japan doesn't have a military.
Oh yeah.
We've got Russia, we've got China right off the coast, right? And in a power vacuum, they could just roll on in and say, that's our country now, because Japan doesn't have a military. We'll take it. We like Japanese food and Japanese mountains and Japanese fields and Japanese resources and Japanese, okay. And without a military, you don't have a country. Any country without a military, the other country is going to say, I'll take that, right? Good fences make good neighbors. Good fences make good neighbors. Okay, that's how the saying goes, right? Good defenses keep your country. Okay. So who's going to defend Japan? Well, the United States. Nobody else is. The other countries would just take it. So America and Japan agreed, okay, we're going to supply your defense while you rebuild your country. You're going to have these Japanese policemen, and one of our military guys is going to stand next to him on the road, guiding traffic, making sure there's no fights, right? You know, nobody's stealing from the grocery stores. Nobody's raping women in the street, okay? And the people aren't running around with guns shooting Americans to try to take their country back. That was the biggest fear. The biggest fear was that the Japanese underground would say, we're going to take our country back, and they'd secret move weapons around secretly and plan night attacks on the Americans and that kind of thing. And it didn't happen because the emperor said, we're done. And people agreed. Wow. Pretty amazing. That was kind of unexpected. Right? It was kind of unexpected that Japan would be so disciplined in its surrender. Okay. So we spent years dumping helmets and swords and guns into the ocean. Seriously. We had entire barges with a bulldozer full of Japanese army helmets. They'd go out into Tokyo Bay, push them off into the ocean, and come back for another load. Okay. I've seen video of these big Japanese battleships being cut up for the scrap steel. The great big guns on the decks of the ships and the Japanese guys are torching the gun apart into big chunks so they can melt the steel down and build Toyota trucks out of it. Seriously. Okay, that was a big effort. The pacification and demilitarization of Japan. So while Japan is being demilitarized, somebody's got to defend the country. And it was us. It was the United States. And so that's been the agreement since 1945. So Japan is not really a fighting ally. Also, according to the Constitution of Japan, they can't have an expeditionary military. They can only have a defensive force.
Oh, yeah.
So the Japanese military is not really a military. It's more like a national guard.
Oh, yeah.
Okay.
Yep.
All right. So fast forward to 2026, and Donald Trump is like, hey, you want the Hormuz open, send your Navy in there. And Takaichi is like, sorry. So what happened? Do you have an opinion? Do you have an idea? What do you think is happening? What do you think happened there? I thought Takaichi was a smart lady. I thought she was friends with Trump.
No. Okay.
Yeah, well, what do you think is the story?
I don't know why they refused to help, but because they can't. I don't know. They don't have enough forces or something.
Japan has a pretty nice navy. It's not like the United States Navy, but they've got quite a few really cool ships, right? They got these frigates and destroyers and cruisers with missiles and radar, and not a lot, not like the United States does, but their navy's pretty high quality. They could send a few ships over to Hormuz to help us out. They could do that.
Oh, yeah.
Also, I think Japan is in agreement with countries like Australia to provide Navy ships for Australia. There's one design called the Mogumi. There's another, a frigate design, which is a smaller ship, with guns on it. What's really nice about the Japanese equipment, it's the technology's high, the radios and the radars and the engines and the fuel consumption and all that kind of stuff. It's pretty, it's nice equipment, right? So I think Australia is going to buy some of this Japanese equipment. Japan had to change the rules to do that. Here's an interesting example. Remember Sony PlayStation?
Oh, yeah.
What was one of the most popular games of the Sony PlayStation?
Oh,
and we're talking PlayStation 1, way back in the day. Maybe before.
I have no clue, but.
Can you guess?
Like Street Fighter or something?
I'll give you a hint. Zombies. Zombies.
Resident Evil.
Okay, but it wasn't called Resident Evil in Japan. It was called
Biohazard.
It was called Biohazard. And when I didn't know about the game in America. I learned about it here in Japan. In fact, one of my old girlfriends gave me her brother's PlayStation 1, and we were playing Biohazard. Oh my God! I remember the first time I had to kill a zombie. Don't make me do it. Don't make me do it. He wouldn't stop, so I had to shoot him. Oh man. Okay. Now here's the Sony Corporation selling this item. This is before the internet, right? So they're selling the DVDs or the CDs or whatever, right? It was CDs, right? The game CD. Imagine boxes of materials that say Biohazard, and you want to send those to the United States. Is that okay?
Well,
Can you imagine the customs officials? Biohazard? No. Turn this ship around. It's a video game. I don't care what it's called. It says Biohazard. We can't take it.
Yeah.
They had to change the name.
That's why. Okay.
That's why it's called Resident Evil. Oh, what is this? A video game? Yeah. Okay. Japan is not allowed to sell dangerous items. to other countries. Yeah. So selling a battleship to Australia, according to Japanese law, is against the law. Doesn't matter how much money they want to pay. So Takaichi's been working very hard to change the law so that they can do that. What alliance? There is no alliance. Japan cannot provide lethal assistance to other countries. Even if it's not their soldiers, even if it's just their equipment, they can't sell Japanese guns, missiles, rockets, tanks, ships, anything that could kill somebody or is designed to kill somebody, whether it's biohazard or a Mogumi destroyer. They can't do it according to Japanese law. So they've been changing that law, and evidently they've had some success, and they will be able to, under limited conditions, sell these deadly weapons to other countries. Of course, Australia, there's your alliance. Okay, so this is the beginning of an alliance, I guess, at least economically, if not actual militarily. Okay. So my understanding is that Japan just can't do this. They just can't send, according to the Constitution. Now, let's say that it was legal, that the paperwork was finished, and it's like, wait, no, we can do this. The U.S. president asked for it, and according to the rules, it's possible. I don't think the people of Japan would be happy about it. I think you'd have a lot of Japanese people that would say, that Takaichi, she loves war. I hate her. I'm sorry I voted for her. I'm not going to vote for her again. Which would be public backlash against that kind of decision. Do you think that? Do you think that's the story? That's the case situation? Does that make sense?
Yeah.
Yeah.
Well,
go ahead. I'm listening. Go ahead.
It might be like only those people that hate her, but you know.
I don't think so. I think people that like her would turn against her if she did that. I think she would lose supporters.
Okay.
Yeah.
Yeah, that happens.
Yeah. Why do you think Japanese people feel that way?
I don't like history. They learned history and they just hate war, in general. So
yeah, I guess that's
they don't want to be a part of it.
I guess that's our fault. Our job was to make the people hate war so they wouldn't fight it again. And we were maybe too successful.
Yeah, it's like the GHQ.
Well, no, this is called the Sherman Doctrine.
The Sherman?
There was a general during the Civil War named Sherman. And his idea was to make war so terrible for the enemy that they would never want to fight it for generations to come. Poison the wells, burn the cities, rape the women, kill their livestock, salt their fields. See what I mean? Don't just destroy their tanks and their guns, but make war so distasteful that they would never fight it again.
It's like no mercy stuff.
Yeah. Yeah. We have a saying in English, all's fair in love and war. It's a very old saying. It's older than any of those uniforms. All's fair in love and war. Right?
Yeah. Oh, okay.
Yeah. So, okay. Human nature, I guess. These things are older than our countries. These are age-old concepts of human.
Like Roman Empire.
Be older than that,
Damn.
Yeah. But evidently Japan is changing step by step. It's going to take time.
Yeah.
It makes sense that Japan would be in a 100-year penalty box, right? Because 1941, World War I, I mean, you can imagine 1945, 2045. Okay, there's your 100 years. Maybe from 2045, Japan could start playing an active role. But until then,
got kicked out of
It's 100-year red card. Yeah.
Yeah.
Kind of makes sense.
They got banned.
They got banned. Yeah. Not a shadow ban either. An outright public.
Oh yeah.
What we call it? Daylight ban.
Oh.
Yeah. Spotlight ban. Okay. Public execution.
Oh yeah.
Okay. Daiji, thank you very much. Excellent topic. Excellent discussion.
Oh yeah.
See if you can get that VPN.
Oh yeah. I'll try. I
Yeah.
think it's in the settings.
Is our holiday next week or 2 weeks from now?
I think it was next week because it was April 30th or something.
The 30th is the holiday you want to take, not the 7th.
Yeah, not the 7th.
Okay. I will.
Already let my mom.
I will see you in 2 weeks. If you need to change it, just send me a message. But otherwise, I'll see you in 2 weeks. Daichi, thank you very much.
Yep. Thank you.
Okay, bye now.
Yep.
Long time no see.
Sorry for
So your boss died?
My previous job.
Oh, okay.
They saw the high levels for high levels of the manager of the.
Yeah. Was he retired?
Yes. So now he's 65 years old, but he lectured out of the thing. So but she suddenly. So
How old was he?
65.
Oh, that's so young.
Very young.
How did he die?
How?
Was it a heart attack? A heart attack?
Not
Oh, he had a stroke.
Stroke.
Oh no. Yeah, okay. Yeah, it's a stroke. We call it a stroke. Blood vessel breaks in the brain, and was he a drinker?
Not drink. Yes, a drinker and a heavy smoker.
So I have a friend that's about his age. He's a guitar player, and he had a stroke, and he was in the hospital for 3 months, and he lost he lost the use of his. He's a guitar player. He lost the use of his right hand, but he can still pick the strings. If it had been the other side of his brain, he would have lost his guitar ability. And his doctor told him, stop drinking and stop smoking. And I saw him a couple of weeks ago. We were at the club, and he had a cane. He had a brace on his ankle because he's learning to walk again. And he quit drinking, quit smoking. So I think you call it ichibyo sokusai. The disease that keeps you healthy. So he got lucky. But this guy didn't get lucky. It killed him. Yeah, that's very sad. Very sad.
I'm very, very surprised.
65, that's young, 65.
65 is not young, but
No, that's young. We are very close to 65.
Yes.
We are very close to 65. That's young.
Close to 65.
My father died at 77, and I thought that was young. But 65, that's too young.
Yeah, so the day for the yesterday, I met him. So he lectured
me to the out of the scene. So the after that, so the bye bye, so they say bye bye.
And that
so,
was the last
but
goodbye.
In the night, so that he died. So I'm very surprised. I cannot understand. So very surprised. So,
Here today, gone tomorrow.
Yes, so so after that, so I went to the funeral, 葬式.
Yeah, the
so
funeral.
so
Did you go to the wake?
Yes.
You went to the wake before the funeral?
The gold
Overnight, the night, you know.
Yeah, it's Japanese name is tsuya.
We call it the wake.
Wake.
Yeah.
Yes, I went to the.
Did you go to the wake and the funeral?
Wake.
You went to the wake, yeah. Okay.
Yes,
Yeah. I remember my first wake in Japan. It was my landlady's. In Shijo Nawate, I used to rent an apartment in Shijo Nawate, and it was the boyfriend of Oya-san. It was the landlady's boyfriend. He was a smoker and a drinker and a party animal, and he had a stroke and died. And I went to his wake, and that was the first. That was 30 years ago. Yeah, our custom in America is different. We have funerals and burials, but Japan has a wake, a funeral, and the cremation where they burn the body, right? I guess the wake is before they burn the body, and the funeral is after they burn the body, and then they have the ashes, right? The ashes.
Yeah, yes.
Are delivered at the funeral.
Yes.
Yeah.
So I saw. I looked at this face.
Yeah, his body. Yeah.
So it's a very strange.
Sad.
Movie, so So Japan is in Japan is a very strange.
No, because many funerals are open casket.
Really? So
It depends on the family. It's case by case.
Case by case. So
if you don't see the body, you don't believe they're dead. In their mind, they're still alive. But if you can see the body, you can say goodbye. It's what they call closure. Yeah. So there are many cases, for example, when the body disappears, like in a war where the body is never returned and the family doesn't know. Like Vietnam was really bad because there were many missing in action. There were soldiers that were killed and they never found the body. And there were families back in the United States where, my father, my husband, my brother never came back from Vietnam. And the family was hoping and praying for years, and they never saw the body. They never had a funeral.
No.
Yeah, that's very difficult. That's very stressful.
Very difficult.
Yeah.
So maybe I joined such a grave and the funeral. So very very long time. So I didn't. Not such experience. So at first I don't forget. I forget the manner.
Oh yeah, the procedures.
Procedure. Yes.
Yeah. Well, I have an excuse. I'm not Japanese.
Yeah.
And so they showed me. They said, "This is what you do. You pick up the tobacco." And then you push it, and then you sprinkle it, and then you move on. And okay.
How many times?
Yeah. Okay. But I'm not Japanese, so I could make a mistake, and nobody would complain. He's a gaijin. So. But now this is my father. He was 53 when I was born. He was a little older.
He's old, very old.
Yeah.
Yeah.
And my mother was his second wife, his second family, basically. And when I was born, he stopped smoking and he cut back on his drinking. He basically ended his party life. But all of his friends were still partying and enjoying. and he went to funeral. He was like the last man standing. Because he changed his life while his friends kept drinking and gambling and smoking. Because he had a young child. He changed his life. And he outlived all of his friends. Now, you and I, if we stay healthy, we're going to watch our friends die. Which is, that's what happens to the healthy men. They watch their party friends, drinking, smoking friends die.
So recently, my friends don't smoke.
Okay, that's good. But you know, Showa was party time. Economic animals.
Economic animals. And it's also very healthy.
Okay.
So in this case, this phenomenon is such a surprise. For the first time for me, such an experience.
Well, this is the beginning. Because after 65, right? Step by step. The eldest and the sickest will start to die. This is the third stage of life here now for us.
I want to be careful for my body and
and that means exercising, and cut back, don't drink too much.
Don't drink too much.
Get enough sleep.
Enough sleep.
Don't work too hard.
Very, very important thing. The previous week, I cancel this lesson.
Well, now we have 5 weeks in June. So I'll see you next week. So
But sorry. The next week, I have to go to Hiroshima.
Oh no! Well, now wait a minute. Can your wife take a lesson?
Yes, maybe my wife is no problem.
Okay. So if she can take a lesson, I'm working next week, so that's no problem.
Yes. After that, today, she joined.
Okay.
After that,
So in your case, in your place, she can take an hour. That's okay. All right.
So the next week,
Well, we have 5 Thursdays, then we have Golden Week, and some people are taking the 30th on a holiday. Some people are taking the 7th on a holiday, but that's okay because I'm here. It's video, so thank you.
So the Panasonic is very Panasonic is very a lot of the holiday.
Okay.
The working from the 29th. From 29.
Oh, the Golden Week.
Golden Week. May the 6th.
Are you going to see your parents?
Yes. My parents. Maybe I said my father is now is in hospital. My mother is in house alone. Okay. She's very sad. She's very
and your brother is in Tokyo?
No, my brother is now in New York.
New York. Yeah, that's right. He was in Singapore for many years.
Yes.
And then he went to New York. So
yes, he's a very international person.
Yeah.
But he is over 60, it's a very strange company for him. And he joined us. He worked in 中国電力.
Yeah, okay.
中国, yeah.
Yeah.
So the very
In
good
New
company.
York, that's interesting. What is he? What is Chugoku Denryoku doing in New York?
Maybe the 中国電力 is invest the American company for the electricity company. So the and 中国電力 gain the money, gets the money from the invest money. Yeah. So the
is it Con Edison?
Edison?
Con Edison, Consolidated Edison. So Edison was the first electric company in the world. And it was in New York, right? New York had the first electric system in the world. So it was originally Con Edison, Consolidated Edison. It was the Edison Electric Company originally. Yeah.
So maybe the US is a lot of the electric companies.
Oh yeah. It's a big world now. But it started with Edison in New York. So that was the beginning. The oldest history, longest history of electricity providers. Yeah. And the first distribution was DC. DC. It was plus and minus like a battery.
Yeah.
And the range was terrible. The farther you got away, the dimmer the bulb was. The people who lived next to the power station had nice bright lights. But the people who lived like 3 or 4 miles away, their lights were so dim. And then, Tesla had a system of AC current. And that was the revolution. The revolution was AC electricity. Yeah.
So the DC is the gradually the power.
Yeah, it didn't work very well. So they converted to AC and what you call the what do you call it? The Hendenjo. Yeah, the substations and power transmission, power transformers. Sorry, transformers. Yeah. But it started in New York. That was the beginning. Yeah.
So sometimes I contact him. So that he is surprised. He is very surprised. So a lot of the price is very expensive. So
the price is in New York.
Price is in New York.
He works for a Japanese company. He gets paid in yen.
Yeah. Yes.
So that's very. Does he get a bonus for working overseas?
Yes. So many Japanese companies arrange
expensive.
Very, very expensive.
Yeah.
So he is over 60 and he is living in New York. So maybe the Chugoku support his life. So it's a very, very good company.
You're lucky him.
He's a very good company.
Yeah. Me, I'm getting paid in yen, but I'm not living in New York. But I live near Osaka Jokoen, so
yes.
Living near Central Park in New York is very expensive. Does he live in New York City?
I think so.
Wow.
So very expensive. So maybe about 60万 50万 per month.
Per month?
Per
for rent.
50万 and 40万. So I forget the.
For his rent, his apartment rent.
Apartment rent is but the company supported the fee. So I cannot.
Unbelievable.
Unbelievable. Unbelievable.
Yeah. Well, I know a little bit about about Panasonic's Microsoft bill. Panasonic pays a lot of money to Microsoft. And with the Enyasu, it becomes very expensive.
Very expensive.
Yeah. Yeah.
Yes.
So.
So maybe we cannot live in New York.
I can't live in New York. This is my New York simulation. This is my Virtua New York here. I call it the New York Soul.
New York Soul?
Soul. New York Rashi.
New York Rashi.
Here. New York doesn't have a castle. We got a castle. I'm happy.
Yes.
My daughter loves Osaka Joe Koen. So.
Yeah, Osaka Joe Koen is very good. So
yeah. So
now is maybe the foreigners a fewer foreigners. Now is
now it's big because cherry blossom spring season is huge.
Yeah. Now is a bit. Now is over. So
but the weather's good, so it's still pretty popular. Still a lot of
Chinese tourists is.
Yeah, but we got European tourists, Australian tourists, Malaysians, Indonesians, Americans, Australians.
Mm-hmm.
Yeah, Japan's popular. Lots of tourists in Japan.
Yeah. So tomorrow, my subordinates in Tokyo come to Osaka. So tomorrow, the discusses about a lot of things. After that, he stayed at Osaka, and Saturday, he will go to Kyoto. So he maybe he enjoys the sightseeing. So but his informations. Maybe now is gradually. So the tourist is the number of the tourists is
decreasing. Okay, because I guess cherry season's over.
Yeah.
Okay.
So he will be looking forward to sightseeing. So
yeah.
Maybe they comfortable. So.
Well, but still, the spring is a good time for Japan.
Yeah, very good time. It's the number one season in Japan.
Yeah, spring.
Gradually, so the temperature is.
It's nice weather. Rain today, but it's what's the weather tomorrow? It was nice yesterday. Yesterday was great weather.
Yeah.
Yeah, the rain's stopping.
Yeah, rain's stopping.
Cloudy tomorrow.
Cloudy, really?
Yeah, but no rain. Yeah. High of 19. Saturday will be warm. High of 22.
22.
Yeah.
So 90. Yeah. So. Yeah. Today is also very cold.
A little bit.
Yeah.
A little bit. But we need the rain because otherwise it's too dusty. We need the rain.
Today is maybe the kosa from China is
well, we want to wash that kosa away. The rain washes the kosa away. Yeah.
Good timing for earnings.
Yeah.
How was the U.S. and Iran war? My business is
I'm sorry. I was going to ask you, how is this Hormuz affecting Panasonic? That was my question.
There are very very good bad effect for our business. Maybe it's about 100 to 120 億円 per year. So the effect of the Hormuz problem. Because a lot of the goods is purchasing goods is the price is up.
This is a power shift for the United States.
Power shift?
It's a power shift for the United States. Now,
Iran to
so you read all of this news. Trump is a crazy man, and he's a dictator, and they say he's Ryojin-byo, and they say all this stuff. It's not true.
Not true.
Okay, so at the beginning of Trump's presidency, the very first steps he took were to make sure that the Western Hemisphere relationships were strengthened. Right? one of the first steps was no more funny business with Canada. Canada was taking advantage of the United States. No more. Stop that stuff. We're losing money into Canada. Why? No more losing money into Canada. Okay. And then re-establish our friendships in Central and South America.
Oh, yes.
Okay. We re-established our friendships with Ecuador,
Ecuador,
with Argentina, with El Salvador, and we re-established a relationship with Venezuela. Okay. Still problems in Mexico, still problems with Colombia, problems with Brazil, but all in all, Panama, Venezuela, Argentina, Ecuador, El Salvador, much stronger relationship in the Western Hemisphere. We don't need Hormuz. We don't need. The United States doesn't need Hormuz.
Yes.
Don't need.
I think so. No need so. Yes.
So on the other side of the planet, Iran is strong arming the region. Iran, China, Russia are trying to dominate the region. Okay, with terrorism, piracy. You know, the Houthis, the Kaizoku, right? Piracy and terrorism and domination, market domination. Okay, well. You know this. I don't know if you know what this game Jenga. Jenga is this game where you stack the blocks.
Yes, I know.
Right, and if you pull, so if you pull Iran out of that equation, it collapses because everything is Iran's resource, the oil. Okay.
Yes.
Right. I mean. If you look at the European collapse, it collapsed with all this Russian oil and gas going through Ukraine. Russia invades Ukraine and Europe was like, no, right? And that was the collapse of the European equation with the Russian-Ukraine invasion, right? Well, the United States is like, we don't need Hormuz, but we need to stop Iran because they're going nuclear. If Iran goes nuclear, then they dominate the Middle East. They destroy Israel. They end up dominating the Middle East. So we have to stop Iran from going nuclear. That's number one priority. Okay, well, if we go in and we stop Iran, that means Hormuz falls apart. We don't need Hormuz. But China, Japan, all these other countries that need Hormuz, well, maybe they should take care of Hormuz security. Right?
Yes.
Japan does have a problem. Now, Japan makes some really good military hardware. Do you know about the Mogumi?
Yes, recently saw that.
Very nice shit. But according to the Constitution, Japan cannot export dangerous materials. If the box says biohazard, they got to change the name to Resident Evil. They changed the name of the video game. Japan cannot sell Mogumis to Australia unless they change the rules. Okay. So if Japan wants to be part of Hormuz security, Japan is going to have to change the system, work with countries like Australia and the Philippines and South Korea, right? So there has to be a new Pacific alliance. That means maybe changing the Constitution. But a lot of Japanese people, they don't like this idea. A lot of Japanese people are against Japanese military.
But yesterday, the newspaper said, the Japanese government,
changing the rules.
Changing the rules.
Yeah, okay. But selling Navy ships to Australia doesn't mean sending Japanese Navy to Hormuz. That's even bigger change. That's a bigger move. Yeah.
Maybe we cannot go to the Hormuz.
Now, if Takaichi in a day, like Trump changes rules in his office, he's like, signs a thing, done, changed. And Trump supporters are like, yay, Mr. President. If Takaichi went out and changed it, there'd be people with their megaphones and their hachimakis, no war, Takaichi down, right? And she'd lose her support. It's I would not want her job. She's damned if she does, and she's damned if she doesn't. She cannot do the right thing. If she does A, she gets attacked by the B people. If she does B, she gets attacked by the A people, right? So she can't do it. She's in a pinch. She's in a pinch. She's in a big dilemma. She's in a big pinch here. Yeah. Navies are important because trade is global.
Yeah, very important.
Yeah.
Sorry,
okay, let us continue this conversation. I think I will see you in 2 weeks.
2 weeks.
Okay, thank you. And I'll see your wife next week also.
Okay. The next week,
yeah, if she can take a lesson next week, she can.
Next week, you can
1 hour
by yourself. By one. Sorry, oh
no, she's working.
She's on the business trip for
Tokyo. Oh no. Do you want to reschedule?
Reschedule is Wednesday.
Yeah, Wednesday is possible.
Possible?
Yes.
What time is available? Wednesday is a holiday, but
8 p.m.
Family is no problem.
How about 8 p.m. on Wednesday?
Wednesday, 8 p.m.
Yeah.
Okay. Sorry. So the questions the Friday.
Yeah, Wednesday the 29th at 8 p.m.
8 p.m. Yeah.
Okay.
Sorry.
Yeah, no worries. Thank you.
Thank you very much.
Okay.
Hello.
How are you?
Hey, how are you?
Can you hear me?
Yes.
Okay. Your husband went to a funeral.
Funeral.
I think his boss died.
Mm-hmm.
Yeah. 65. That's young.
Yes.
I'm 60.
Mm-hmm.
How old is Kazushi? How old is he?
55 or
okay.
60.
Yeah. Close.
Yes.
Take care.
Yeah. So today, I use apply.
Oh, show me.
Helpo apply.
What's the name?
Helpo.
Helpo?
It's an online,
Sounds like dog food. Helpo.
Online hospital, like
oh, I see. Like a WebMD?
Yes.
Oh, I see. Helpo.
Helpo. Yes.
That's not a good name. Because in America we have a dog food.
Helpo?
No, it's the name is Alpo.
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 Maybe it's from health. Or
I know, but you have to be
or
careful because
Point.
Alpo is a famous dog food.
Ah.
And it sounds like Helpo sounds like Alpo.
Oh.
Yeah.
Yeah.
The Japanese don't know, but it's famous in America. So you would never use that name. Helpo. What? Sounds like dog food. So it's supposed to be health app or something.
Yeah.
Okay.
So.
What does it help you? Is it for what? Tell me about this Helpo app.
We can reserve doctor
Appointment? Oh, interesting. Okay.
Doctor.
All right.
And we can ask the medicine.
Oh, okay.
And they send me the medicine.
Oh, really?
Yes.
And this is a Japanese government approved system?
Oh, yes, I think
Okay.
so. So we can register our my number card.
I see. Yeah.
And address and card number.
Yeah.
So
I want nothing to do with this. I don't want any. I don't have a my number. I don't go to hospitals. I did not get the corona vaccine. I don't want anything to do with this.
Wow.
Yeah. I'm very old fashioned.
Wow.
Yeah.
Because I have an allergy.
Oh yeah.
So I need the medicine.
Is it steroids?
Yes,
You take
yes.
steroids?
Not kind of steroid. It's a weak allergy medicine.
Oh, okay.
Oh,
Is it the Campo?
not Campo.
It's not Campo. I have many students who are pharmacists or pharmacologists, right?
Mm-hmm.
You know, they work at the pharmacy. And I asked them, you know, what's the most popular drug? And it's the Campo Yaku is the most popular drugs at the drugstore. That's interesting. In America, the most popular drugs are the very dangerous, very artificial chemicals.
Yeah.
But in Japan, I was like, what's all these people going to the drugstore? They're getting herbal medication. I said, okay, that's interesting.
Or supplement.
Yeah, okay. And then Japanese food and Japanese lifestyle is a lot healthier. In America, everybody drives a car and the volume, you notice the volume of food at the restaurants.
Mm-hmm.
Right. Yeah. So I'm glad. I'm healthier than my friends my same age as me. I'm much healthier than they are. Yeah.
Yes.
Yeah. So life in Japan. Lots of, you know, seafood, nori, right? Low carb, you know, fish and I'm non-sugar. Non-sugar, no sugar.
Never?
Well, but rare, very rarely.
Rare.
Just cheating. Some days we cheat. The kids don't get ice cream. We freeze grapes, frozen blueberries in the summertime.
Mm-hmm.
Yeah.
Oh,
My daughter makes frozen banana ice cream. She takes the kitchen wrap, she wraps a banana and smashes it, puts it in the freezer for ice cream. Yeah.
Wow, so healthy.
I make my own yogurt.
Mm-hmm.
The kids don't like it. They're like, it's stinky. I'm like, what about your natto? That's stinky. They eat natto and I eat homemade yogurt.
Oh.
Yeah.
So do you have any machines or?
No. I take a big pickle jar.
Mm-hmm.
When I start, like 3 years ago, I buy a pack of R1. I dump it in the pickle jar with milk. Use half and fill. Use half and fill. Yeah. In the wintertime, you keep it over the hot pot to keep it warm, right? Summertime, you don't have to worry. But when I snack, I get hungry. No more ice cream, no more candy bars, no more peanuts, chocolate. It's olives, sausage, cheese for snacking. Yeah.
Maybe healthier than Japanese.
Yeah, Japanese people eat too much rice. Too much rice and too many noodles.
Yeah, so carbon.
Yeah, low carb is the best.
So,
yeah, low carb. Try. So many restaurants, they say, omori murio. You know, big rice is free of charge.
yeah.
And I'm like, no. Give me regular rice and 2 pieces of fish. That's expensive, but it's healthier. Or if you want to be filled, you have a salad. Instead of a second bowl of rice, you eat a salad. Yeah.
Yes.
Japanese people eat too much rice. One bowl is okay, but 2 bowls, 3 bowls. I get sick. If I eat too much rice, I get sick.
Oh,
Yeah.
yeah,
I get sick. Japanese people have a long. Their intestines are long. But white people, we have these short intestines, and if you eat too much rice, it pulls the vitamin B out of your body. You get kake. Right? You know kake. Kake. Yeah, we call it berry. It's a vitamin B deficiency. Too much rice. So yeah, my first year in Japan, because I was eating too much rice. So I cut back on rice. More cheese, more meat, and I got better. Yeah. White people need lots of dairy, milk, cheese, yogurt.
Yes.
Yeah. Of course, Japanese people, fish. Fish is good. Salmon. Bonito. Japanese people eat a lot of fish. Be careful, not too much rice. And too much beer. Japanese people love the beer. Beer is so high carb.
Yeah.
Switch to red wine. If you want to drink after dinner, you switch to red wine. Stay away from the beer. Too much carb.
Wine is
low carb. Wine is low carb. Yeah. And no smoke. Your husband doesn't smoke, right?
Not now.
Oh, he did before?
Before.
Oh, okay.
Yeah, when he was young.
What is your bad habit? Chocolate? Teremis?
Maybe sometimes too much drinking.
Yeah, okay. So when you're drinking, what do you drink when you drink? What is your choice?
I like Japanese sake.
Oh gosh.
White wine.
White, yeah, that's not so bad. Stay away from the shochu. That's how you get, his boss had a stroke, right?
Oh.
What was it? Kekkangiri or whatever, a stroke. The shochu does that. Yeah, be careful. We eat lots of eggs, lots of butter, grass-fed butter, free-range eggs. Yeah. High protein, low carb, high fat. Butter is good. Cheese is good. Salmon is good. Rice, keep it low. Noodles are dangerous. Have a salad. Instead of a second bowl of rice, have a salad. Soup is good. Soup with every meal. You want to feel full.
Yes.
But eat rice to feel full is dangerous. Yeah. Of course, you get enough exercise. You walk a lot. I think Japanese housewives get lots of exercise.
Well,
hanging laundry and bicycle to the supermarket and right. It's the men that don't get enough exercise. Yeah. Sitting at a desk all day, clicking a mouse and a keyboard. Not good.
Yeah.
Washing windows and hanging laundry. That's
it's a good exercise.
Yeah.
Yeah, I do Pilates.
Oh, where?
In Senichuo.
Senichuo. Yeah.
Yes. So there are many old people.
Elderly people.
Elder people.
Okay.
Maybe 70 or 80.
Yeah. Good.
There are many machines. It's support or elder people.
Yeah. Okay. Health clubs. Yeah. Good. I think the best thing for me, I stopped riding a motorcycle. Motorcycle is not healthy.
Oh, motorcycle.
Yeah, motorcycle's not
bicycle.
A bicycle, okay. Motorcycle's not healthy.
Yeah.
It's dangerous for the road, but it's also bad for your body because you just need, bicycle. I switched. I go to Homachi on bicycle. No more motorcycle.
So do you use a loop?
No, I have my own bicycle. I don't need loop. I have a nice bicycle, aluminum bicycle.
Yeah. My colleague, he changed his job.
Oh, okay.
He now is working in Loop.
Oh, the Loop company.
Loop company.
Yeah, okay. Lots of tourists use the Loop. Yeah. They don't know how to use the taxis. They don't know how to use the taxis, or they don't want to pay for the taxis. Are expensive in Japan.
Yeah, it's very convenient.
Yeah, I have my own bicycle, so I don't need that. But that's nice. Rental bicycles for the tourists. Hello, Loop, and there's one more. Oh, Bike Share. Bike Share, yeah. After midnight, the trains shut down, and you're stuck, and taxis are too expensive. So.
Yeah.
But I used to take the train out and a red bicycle back. Then I forget it. I'll just take the bicycle out and back. So. And I sing, which is good exercise. And at the bar, I drink tea. I pay 500 yen for hot water. I have my tea, my chamomile tea while I'm singing. I'm a non-alcohol singer. Singing is exercise. Yeah. It's really flat here. So bicycling around here is easy. Toyonaka, sorry. Suita, no. It's just all hills. No.
So many slopes.
Too many. Yeah.
I'm working on the Sekisui House US project.
Yeah.
Till now. And now we are making a brand guideline. For global.
Okay.
Global guideline.
Okay.
So, and maybe we will make some video.
Oh, nice.
Video. So
oh, wait. Did you finish? You said you were doing a shoot. You were doing a video shoot or something last time we talked.
That was Ono Pharma.
Yeah, that was the medicine company.
So,
Yeah, okay. All right.
So 60 House US, maybe we can go to the US again.
Again?
So,
You say we, you and your coworkers, not your family.
not my
It's a business
family.
trip. Again, when?
I don't know, maybe the autumn.
Okay. Is it Denver again?
Then Denver or Texas. Or,
Yeah, okay. Interesting. Be careful of Helpo, Alpo. I think the local agents know. They have native people in the company, right?
Yes.
Yeah, they know how to be careful. There's I think I've told this story before. Years ago, Coca-Cola went to China. I think it was the 1980s. You know, China was this closed communist country.
Yes.
But then I think his name was Deng Xiaoping. I don't know the Japanese yomi for that, but we called him Deng Xiaoping, was the leader of China. And he wanted to open China after Nixon to trade. Okay, all right.
We call Toshouhei.
Oh, that's right, Deng Xiaoping. Yeah. So Coca-Cola came to China. And the Coca-Cola people were like, okay, we need a big sign. So they looked in it, they used a Chinese dictionary and they found Coca-Cola. All right. Tamajashi o kamu. Huh? The Americans didn't know that the kanjis have meaning. They just thought it was sound. And people were laughing. They're like, no, nobody's going to drink that. So they had to redesign their advertising and they came up with taste happy, taste good. There is kanji for Coca-Cola. Right? Ko is aji. Ka is shiawase. And ko aji. Ra like nara, like goodness. Yeah. So they found new kanji for that.
Wow.
But the first time was a disaster. You know about cow piss. It's called Calpico in America. They changed the name because cow piss doesn't sound good. Pocari Sweat? No. I don't know what. I don't even know if it sells in America. Aquarius, that's a good name. But you have to be careful. Some names, not good. Panasonic's a great name.
Great name?
Yeah. Panasonic is, I don't know whose idea that was. That's a good one. Sony, that was very popular. No problems. Yeah. But
so how do you feel the sounds of Panasonic?
It's great. It's a great name. And white and blue. It's kind of like Pan American Airlines. It was Pan Am and Panasonic. It's kind of almost a little pakuri because blue and white, but it works. It worked. It was very big hit. Yeah, but I think they're using local, native speakers to help them. But Helpo, not good. Oh, it's really case by case. You have to be careful.
Oh, we have to suggest and present the new brand name also.
For the homes?
Right.
Yeah, didn't we talk about this a few months ago?
They have two lines.
Okay.
Of house production. So one is Sherwood.
Sherwood. Now, how do you spell it?
SHAWOD.
Okay, that's not so bad. It sounds like Sherwood, like that. Where Robin Hood. You know Robin Hood? He came from Sherwood Forest, but it's SHERWOOD.
Oh.
And I don't know if you can use that name because it might be associated with a British chime. Sherwood Forest is a location. It's a chime in UK.
No, in fact, SH means Sekisui house.
Oh, okay, that's fine. But instead of SHA, it's SHER. Yeah. So Sherwood is one example. And what was the other name? You said there's another name?
It's not, have not decided, so we have to present the name.
Sicky sweet. That's hard. Isuzu is hard too. Toyota, that's easy. Honda, we don't say Honda, we say Honda. That's easy. But Sicky sweet, that's hard. Mitsui, that's hard. Mitsubishi's hard. That's a little difficult. Yeah. Sony's easy. Panasonic's easy.
Yeah. Sometimes the translator, the AI translator, they
suggest
sexy house.
Yeah, be careful. Yeah. You can just use the letters. I remember when TDK was really big in America. The cassette tapes. TDK was huge. We didn't care what does TDK stand for? Tama Den Kabushiki something. Who knows what it means? Yeah, but it didn't matter. NGK spark plugs. You know, the spark plugs for engines. NGK, big name. Yeah. So sometimes the letters are fine, like SH. Okay. You can just use SH, SNH houses or something. Yeah. Easy to remember. No problems. UFJ is not a real good name. It's because FU means I hate you, you know. And so UF is not a good combination. Right. Mizuho. What? Mizuhole? A hole in the ground? I don't know. That's not really good either. Yeah. Senshu Ginkgo. It's like, where's my money? Well, last week we lost it. It's Senshu Konshu no Ginkgo. Right? I don't think that's a good name either. It's really case by case. But sometimes letters are fine. Sometimes. Sometimes not. There's this company in Japan. I see they have these trucks. The company's Alsoc. The security
company.
It's not good.
Not good. Why?
Yeah, because to suck something is not good. You all suck. You know, it's like not good. Yeah, sorry.
Oh.
No. There's also a company called Lixus. Lixus. They licks us. It's like, no. Yeah. Well, I tell you what, when you come up with the idea, send me a message. We'll discuss it. But in many cases, just using letters like TDK. TDK was fine. I'm trying to remember some other names like Fuji something is always good. Fuji. You know, there's lots of Fuji. Fuji means Japan to people.
Oh.
Yeah. I don't know if you can use that name or not. But Good luck.
Yeah.
What? So
thank you.
the two brands would be different, like categories. Like the Sherwood is the high end, and the
Yes, that's right. It's more normal.
yeah. Let me know what you come up with, and we'll talk about it.
Okay.
I think next week we've switched to Wednesday because you have a business trip on Thursday. So I think I'm going to see you next Wednesday.
Yes.
All right.
Okay. Thank you very much.
My pleasure. Do you have a question?
No, thank you.
All right. I'll see you next Wednesday.
Okay.
All right. Have a good week. Take care.
You too.
Bye.
おやすみなさい。
As with the last few updates, this
Oh, gosh. Good night.